Kanche, bonsoir. June is National Indigenous History Month, and June the 21st is National Indigenous Peoples Day. These occasions provide an opportunity to recognize and celebrate the diversity of our First Nations, Inuit and Métis friends, and neighbors and their contributions to Canada. Today, we open our meeting by honoring the Algonquin Anishinaabe land, a nation, land, and people. Ottawa is located on unceded territory of the Algonquin Anishinaabe Nation and is a gathering place for many Indigenous peoples. On behalf of the Board of Health, I would like to honor the land and the peoples of the Algonquin Anishinaabe Nation, whose ancestors have lived on this territory for millennia, and whose culture and presence have nurtured and continue to nurture this land. I'd like to extend that honor to all First Nations, Inuit and Métis people, their elders, their ancestors, and their valuable past and present contributions to this land. We are honored by the presence of 3 elders this evening, representing Ottawa's diverse Indigenous communities. They'll be sharing their prayers as we begin our meeting. Now, please join me in welcoming First Nation Elder Grandmother Irene Compton from Soltur First Nation, Inuk Elder Ega Adagusiak, and Métis Senator Parm Bergy. I would now ask the elders to take their turns sharing their opening prayers. Thank you. Kuyanamik, Marci, thank you. We're now going to move into the regular part of our meeting. And I'm going to ask that the board secretary carry out the roll call, please.
Member Bam?
Present.
Member Cloutier?
Present.
Vice Chair Di Giovanni?
Present.
Chair Eglai?
Here.
Member El Shantiri?
Present.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member Lakin?
Here.
Member Menard?
Present.
Member Pinel?
Présent.
And Member Tilly?
Present.
You have quorum, Mr. Chair.
Thank you very much and welcome everyone. We have no regrets. I'm going to run through the Zoom meeting procedures. Hopefully we'll get to a day when we don't have to do this anymore. The following procedural guidelines are being implemented to promote orderly proceedings in this virtual meeting. Attendance, first of all, should members need to leave the meeting, they should advise verbally that they're doing so before clicking on leave meeting from the Zoom platform or ending their call if participating by phone. The process for speaking and the speaking order will be, I will provide each member with the opportunity to ask questions or comment. Members will be called on to speak in order or reverse order as set out in the board secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on any given matter, you may decline verbally when your name is called. Voting. If a full recorded vote is not taken for a given item, I will specifically ask if the item is carried and then call for dissents to ensure that all votes are properly registered. Points of order, privilege, or challenge. Procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Should we have a recess due to technical difficulties or other unforeseen matters during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. Are there any declarations of interest?
None.
Okay, seeing none. Can we confirm the minutes of the meeting of April 19th, 2021? Carried? Confirmed?
Carried.
Thank you. We have 7 communication items that have been received and held on file with the board health secretary. Can the board receive the communications as noted in the agenda?
Received.
Received.
Thank you. I'm going to call on the vice chair, please, for the motion to introduce reports.
Sure. Be it resolved that the chair of the Board of Health verbal report, the medical officer of health verbal report, and the reports titled Ottawa Public Health Strategic Plan for 2019-2022, update from Q1 of 2021 and 2021 operating and capital budget Q1 Board of Health for the City of Ottawa Health Unit Status Report be received and considered.
Is that motion carried?
Carried.
Thank you. I'm now going to go through the usual consent agenda process. For those participating or watching from home who may not be familiar with this process, I will list each item on the agenda and for any items where board members don't have questions or concerns and we don't have public delegations registered to speak, the board may carry or receive these items on consent, which is to say without any discussion. So first off, we have the chair of the board's verbal report. So we'll hold that. That's followed by Dr. Etch's verbal report. We'll hold that. Next is the Ottawa Public Health Strategic Plan for 2019 through to 2022, an update from Q1 of 2021. We do have a delegation for that matter, so we will hold that. And the final item is the 2021 operating capital budget Q1 Board of Health for the City of Ottawa Health Unit status report. Can we carry that?
carry,
Thank you. We'll go back now to the first item on the list, which is my verbal report. Firstly, what I'd like to touch on is the recognition of the 215 Indigenous children whose remains were found in BC. On May the 30th, flags across the country were lowered to honor the lives and memories of the 215 Indigenous children whose remains were found at a former residential school in Kamloops, British Columbia. Sadly, we know that there are many more children across the country whose remains have yet to be recovered. It's important that we not only recognize the impacts of colonization, but that we actively work to raise awareness of the residential school system and how its multi-generational impacts are still felt today. The impacts of residential schools are long-lasting, and while they seem far in the past, they are actually quite recent. It's important that we continue our reconciliation journey. As each of us reflects on our individual and collective responsibilities, let us examine our beliefs, structures, systems, and our relationships with Indigenous people. I encourage everyone to read the Truth and Reconciliation Commission's report and calls to action, and to consider what we can do as a public health organization to actively address the legacy of colonization and ongoing systemic racism in Ottawa and beyond. In doing so, we will honor Indigenous children and their families who were harmed by the residential school system. As part of my verbal report in April, I updated board members on stigma training, and OPH's mental health and substance use unit provided to members of council and their staff, entitled Stigma, the Power of Language in Supporting Your Community and How Well Received It Was. Board members may recall that in April, I reported on the 2 virtual sessions held in March. Further to discussions at the April meeting, the training was offered again in May, and I'm happy to say that an additional 2 counselors and 12 counselors' assistants participated. As explained in April, this 30-minute training helps explain what stigma is and how it might prevent people from seeking proper care. It also provided tips and suggestions on how to use language that prevents stigma, including concrete examples that we can all use in our daily interactions. I would like to again thank the team for organizing this training, namely Linda Cove, Carolyn Balla, Chanel Brown, and Erin McClellan. I'm told that OPH's mental health team is exploring options to make this training more broadly available within the city. As some of you may know, every year for the past 20 years, the Ottawa Board of Trade and the Ottawa Business Journal recognize 40 young entrepreneurs under the age of 40 for their business achievement, expertise, and community involvement through their 40 Under 40 Award. The 40 Under 40 is one of the most distinguished and sought after awards for young business leaders in the National Capital Region. And this year, I'm very happy to share the news that OPH's very own Benjamin Lakin, Program Manager of Mental Health and Substance, will be one of the recipients. Ben's drive and dedication to bringing awareness to improving mental health in our community is very commendable. Please join me in congratulating Ben, who, along with the other 39 recipients, will be celebrated on Wednesday, June the 23rd at 8 p.m. in a live stream presentation. I know we're on Zoom, but feel free to clap. I think it's well worth it. Well done, Ben. Rogers subscribers can watch on channel 22 on YouTube Live. Close to the broadcast date, a YouTube link will be posted on the Ottawa Board of Trade's 40 Under 40 webpage, which the board secretary will be happy to share with board members. I'm also proud to share that the International Association of Business Communicators, Ottawa, has selected Ottawa Public Health's Communications and Community Engagement Team as this year's recipient of its Communicator of the Year Awards. So big congratulations to that team as well. And claps again, yes. Thank you, Dr. Etches. Throughout the COVID-19 pandemic, OPH's social media feeds have been a key source of information and often humor for people in Ottawa and beyond. OPH's communications and community engagement team has worked hard to keep abreast of the latest information and to provide clear, engaging, and timely communications to the public, to partners, and to stakeholders. Their approach is focused on honesty, empathy, relatability, and respect, while injecting humor and recommending actions residents and partners could take to restore a sense of control in an ever-evolving situation. As such, this is a well-deserved honor on behalf of the Board of Health. I'd like to offer heartfelt congratulations to the entire team. Now I'd like to speak briefly to Canada Day. As you all know, Ottawa's COVID-19 rates have been slowly coming down over the past several weeks. At the same time, our vaccine coverage has been steadily growing. I want to thank Ottawa residents for their part in these successes. It's thanks to your continued adherence to public health measures that we've been able to bend the curve of COVID-19 in Ottawa. And thanks to your willingness and eagerness to access the vaccine that we're growing our coverage rates daily. Decreasing COVID-19 rates and increasing vaccination coverage, coupled with the beautiful summer weather and gradual reopening of our economy, have me feeling cautiously optimistic. And I'm sure I'm not alone in feeling that way. With Canada Day around the corner, many may be thinking about how to celebrate this year. Although we are getting closer to our goals, we are not quite there yet. So I would ask everyone to please celebrate safely if you are celebrating this Canada Day. If you're going to get together with a small group of friends or family, remember that outdoors is much safer than indoors. Keep physical distancing and wearing a mask in situations where you cannot maintain physical distancing. Keep up with your hand hygiene and stay home if you're not feeling well. It's important that we all keep doing everything we can to keep COVID-19 under control in our community and to prevent a resurgence. That concludes my verbal report. I would be happy to take any questions. Seeing none, can we receive the report?
Received.
Next on the agenda would be Dr. Etch's verbal report, but Deanne has just let me know that our Inuk elder, Iga Agutsiak, who couldn't join us earlier, is joining us now. And I'd like to call on her to please share her prayers with our board members. Welcome and good evening.
Sounds good.
Okay, so let's do that, Dr. Etches. If you could start your report, and Zian, if you could let us know when the issue has been resolved, and then we'll switch it over. Thank you.
Right, well, I want to say ula kut to our elders, and also, Kwe and Tanshi and Enge. Bonsoir. It is the case that tonight I'll also provide some updates on our work with First Nations, Inuit and Métis partners and community members, our efforts to combat racism and the local COVID situation and vaccine rollout, including an update on case and contact management, outbreak management. I'll take time to speak a bit about the work we're doing heading into the fall with respect to the board's mental health and substance use strategy and return to school, and just finishing with a few words about Ottawa Public Health's Rejuvenate, Restore, and Reimagine planning. So it's a little like few things. So make note of your questions, and we'll come back to the topics. To begin with, Ottawa Public Health is recognizing the unique impacts that the COVID-19 pandemic has had on First Nations, Inuit, and Métis communities, given pre-existing disparities arising from the experience of colonization. So we've been supporting local Indigenous-led organizations who have been on the front lines working to protect community members. And we're recognizing the additional grief for many with the news of the children's bodies being found on the grounds of the BC residential schools. Thank you for noting that, Chair. Our aim is to support Indigenous leadership within Ottawa as they advance plans and healing from residential school trauma and loss. And a key aspect of Ottawa Public Health's board-approved Reconciliation Action Plan is to keep learning in relationship with Indigenous partners and OPH team members. And so we've been regularly meeting with partners, certainly with a focus on the pandemic response and advancing COVID-19 vaccination together. And now team members and I are reconnecting with other Indigenous leaders this month to listen and hear what more we could be doing to respond and recover in a way that builds more access to health and well-being. We're continuing to work through our Reconciliation Action Plan, and normally we'd use June to provide you with an annual evaluation. We will be bringing feedback from partners to you in a September report this year. And I just want to note that the Reconciliation Action Plan is not a checklist per se. It's really pointing to work that's about engagement, about relationship building and ongoing learning. And so we are taking the lead from partners about what is needed at this time. And board members may be aware that Indigenous adults were identified as a phase 1 population in Ontario's vaccine rollout. It's Wabano Centre for Aboriginal Health and the Akausavik Inuit Family Health Team, as well as Tunga Suvinga Inuit, that have been working with us to offer culturally safe access to COVID-19 vaccinations for First Nations, Inuit, and Métis community members in Ottawa. And through these partnerships, nearly 30,000 first and second doses of the COVID-19 vaccine have been provided to date. We're also partnering with the Ottawa Aboriginal Coalition's Research Committee on a study to understand and document First Nations, Inuit, and Métis people's experience with COVID-19 from the perspective of community members, as well as the urban Indigenous service providers in Ottawa. As previously noted, COVID-19 has had a disproportionate impact on racialized communities in Ottawa, and in particular, the impact was most severe on communities affected by the intersections of race, immigration, and low-income living. Black immigrants in low-income neighborhoods seem to be experiencing the most adverse impacts. And we continue to see the evidence that racism is a public health issue, as was stated in a motion adopted by the board at its meeting of June 15th, 2020. Racism, discrimination, and stigma are associated with poor physical, mental, and emotional health and higher mortality rates. Le racisme, la discrimination et la stigmatisation sont associés à une mauvaise santé publique, mentale et émotionnelle, et à des taux de décès plus élevés. The World Health Organization identified that social inclusion and non-discrimination are a global social determinant of health. According to the WHO, social determinants of health are the non-medical factors that influence health outcomes. They're the conditions in which people are born, grow, live, work, and age, and the wider set of forces and systems shaping our conditions of daily life. So we know, and research shows, that the social determinants of health can be more important than health care or lifestyle choices in influencing health. And Health Canada also has classified race and racism as a determinant of health, noting that experiences of discrimination, racism, and historical trauma are important social determinants of health for groups such as Indigenous people, LGBTQ, and Black Canadians. So I want to take this opportunity to reiterate that Ottawa Public Health is committed to engaging and working with residents, with partners, and communities to develop the conditions that will support health and health equity for everyone in Ottawa. Je tiens à répéter que Santé publique Ottawa s'engage à collaborer avec les résidents, les partenaires et les communautés afin de créer les conditions nécessaires pour favoriser la santé et l'équité en matière de santé pour tous à Ottawa. We're committed to respecting the diversity of all residents as we strive to ensure that our services are free from discrimination and inclusive and reflective of all we serve. So we're embracing diversity at all levels, including race, ethnocultural identity, and immigrant status. And in terms of work and actions that we've undertaken with racialized populations at this point, I'll touch on a few. Ottawa Public Health is continuing to monitor and analyze socio-demographic data to understand COVID-related inequities. These insights have been used to guide vaccine allocations regularly, and they continue to support populations that, guide services that are supporting populations the most disproportionately impacted. We have seen progress in diversifying the Ottawa Public Health workforce to better orient our services for the greatest impact. And Ottawa Public Health's Community Operations section has worked to establish a community-informed pilot with Somali, Arabic, and French-speaking African, Caribbean, and Black populations. Ottawa Public Health team members continue to engage with partners and residents to identify barriers to accessing vaccine and other health social services, and we're tailoring options for various communities. I'm now meeting regularly with the director of the Ottawa Local Immigration Partnership, India Mahamud, to advance collaborative work focused on improving the health of newcomers and the racialized population in Ottawa. I was invited to speak at a recent Black Health Summit with India to share ideas for a more equitable vaccine program. And I'm continuing to participate in Ontario Health's Black Health Work Group. It's to advance health system initiatives that are focused on the health of the Black population in Ontario. The ongoing work to build meaningful relationships with communities will further inform Ottawa Public Health's approaches into the future. Ottawa Public Health continues to advocate for the implementation of the recommendations in the Mental Health of Ottawa's Black Community Research Study, while also identifying opportunities to share these findings further. Following the release of the report, Ottawa Public Health completed a needs assessment, and we developed training for faith leaders, given that findings from the study indicate that faith centers were among the top 3 locations that African, Caribbean, and Black participants sought mental health support. And so to date, over 400 faith leaders have been reached with mental health promotion and crisis prevention training. In addition, we've worked with the Somerset West Community Health Center to complete an environmental scan of African, Caribbean, and Black specific mental health services. We're an active member of Ottawa's Black Mental Health Coalition, and we worked with the coalition to host information sessions to commemorate Black Mental Health Week this March. And we've implemented a communications plan to increase awareness of the significance of Black Mental Health Week and promote the African, Caribbean, Black specific community mental health services. On the launch of the Black Mental Health Week, we participated in a panel discussion to share findings from the mental health of Ottawa's Black community, and again, promote the services specifically available for Ottawa's Black community. Ottawa Public Health team members have developed an anti-racism and anti-oppression workplace policy, which is currently being reviewed by Ottawa Public Health team members and community partner consultations. And we are a member of the Equity Ottawa Community of Practice, which is focused on building internal capacity in organizations to cultivate inclusive and equitable organizations. And so we appreciate the insights that this group is providing. While we have made progress in recruiting and hiring people who represent the community on the school team, the community engagement team, and others, our public health leadership team appreciates that we need to be deliberate in the application of human resources approaches informed by the city's anti-racism secretariat to retain a diverse workforce and promote more diversity amongst management. Ottawa Public Health has expanded the Have That Talk campaign to include 3 additional videos on the impacts of racism and microaggressions on mental health and how to talk to and support youth that are experiencing racism and discrimination, and about how to be an ally. And so also on this topic, in April, the Ottawa Public Health teams collaborated with the City of Ottawa's Anti-Racism Secretariat, Somerset West Community Health Centre, and the city's Community and Social Services Department to host an information session on race-based stress for staff from youth serving organizations like Youth Futures and Neighborhood Ambassadors and the Boys and Girls Club. The interactive session was informed by youth and it was very well received. And a recording of the session is available for youth program coordinators to deliver to new staff in order to increase their understanding of the impacts of racism and provide strategies to better cope with stress. Following the board's June 2020 motion, we will make use of an upcoming strategic retreat to host further learning opportunities for you on racism as a public health issue and to seek your input on how to build more anti-racism work into our strategy. We know that part of the Ottawa Public Health role is to raise awareness about racism and the impact it can have on people's health and well-being in order to build buy-in for countermeasures. And racism is a difficult subject to discuss in some formats, like on social media. And so together we continue to learn about how to speak to racism as a public health issue. The lessons learned about how to discuss racism and health are key to advancing work with community members, health, social services, education, business, and other partners needed to close the gap in health status for racialized and Black populations. Les leçons apprises sur la façon de parler du racisme et de la santé sont essentielles pour faire avancer le travail avec les membres de la communauté, les services de santé, les services sociaux, l'éducation, les entreprises et les autres partenaires nécessaires pour combler les écarts dans l'état de santé et des populations racialisées et noires ainsi que des peuples indigènes autochtones. So I'm going to move and switch subjects, but it's not unrelated when we talk about the current COVID situation in Ottawa. Chair, would you like me to continue?
Yes, I would at this point. We're still having difficulties making contact, so please do.
On June 11th, the province moved to step 1 of its reopening plan. And as both residents and business owners celebrated this move, it was refreshing to see Ottawa coming alive again. The pandemic's been especially difficult for local and small businesses, so we're pleased to see the gradual reopening and some more return to work. I want to thank businesses for their perseverance and their continued commitment to implementing public health measures within their facilities as things reopen. We know this is important to protect themselves, their workers, and their clients. Nous savons que c'est important pour leur protection, celle de leurs employés, et de leurs clients. And I also want to thank Ottawa residents for continuing to respect public health measures while visiting local businesses. We encourage everyone to keep supporting local businesses whenever and however they can. With respect to the data, many of our indicators are showing a positive trend. The outbreaks and hospitalizations continue to decline, as do the number of people testing positive for COVID-19. Most notably, our weekly COVID-19 rates have gone from over 200 per 100,000 people per week at their peak in mid-April to our current rate of just about 14 per 100,000 people per week testing positive. We are seeing the testing numbers go down and the COVID wastewater fluctuating. So we're mindful that the level of transmission in the community is still much higher than it was at the beginning of last summer. We're contending with more transmissible COVID variants. So we want to keep pushing towards higher levels of immunization with 2 doses before we can rely on vaccines alone to keep COVID at a low manageable level that's not going to lead to significant hospitalizations. And we are expecting that this will be achieved 2 doses for everyone who wants one by the closer to the end of the summer. And we're expecting further guidance from the federal and provincial level for those at different stages of the vaccination process. What can I do when I have my 2 doses? So for now, my advice is the same, regardless of your vaccination status. It helps all of us when we continue to promote the social norms of wearing a mask when you can't maintain distance from others. We can choose lower risk activities and stick with outdoors as much as possible and avoid crowded places. With respect to our vaccination efforts, as of last night, 76% of Ottawa's adult population has received at least 1 dose and 20% has received 2 doses. And when we think about the overall population level of protection, it's 65% of residents have received 1 dose and 16% have been fully vaccinated. So Ottawa Public Health and the City of Ottawa continue to operate community clinics at locations across the city and pop-up clinics in priority neighborhoods. Vaccines are also available at pharmacies in and around Ottawa and in some primary care settings. The website ontario.ca/COVID vaccine provides residents with information on appointment booking options, including a list of participating pharmacies. On our own website, ottawapublichealth.ca/COVID vaccine, COVID-19 vaccine, is also regularly updated with clinic information and frequently asked questions about the vaccines, including about safety. The vaccine rollout continues to incorporate neighborhood-based approaches, which includes supporting individuals disproportionately impacted by COVID-19 and who may face barriers to accessing the vaccine. And currently as well, with the expansion of the availability to include 12 to 17-year-olds, we're building confidence and promoting youth access to the vaccine, aiming to have eligible youth fully vaccinated before the start of school. And I wanted to take a moment to thank Mr. Anthony DeMonte for his leadership in the vaccine operations, for the support of the city's senior leadership team, the Emergency Operations Center team, and all involved in this continuously adapting vaccination program. There's no question that you've made a significant difference in the health of our population. So other ways that Ottawa Public Health learns about COVID-19 and is working to promote a low and manageable level of COVID-19 is through follow-up with people who test positive and their contacts, as well as recognizing and managing outbreaks. So following the spring surge, Ottawa Public Health has since resumed full contact tracing investigations with all people who test positive. The team's using digital tools to collect information at times and is also working with provincial contact tracing team for assistance with collecting socio-demographic information. Most known exposures continue to be from household contacts and social contacts, that's 51%, followed by outbreaks at 9%, and rarely from travel, less than 1% of the time. The case and contact management team investigators are on the lookout for the origins of people testing positive, as well as working to prevent onward spread. Yet the percent of situations where someone is unable to identify a source continues to be about 28% of the time, a figure that suggests undetected community spread. The Voluntary Isolation Center initial funding from the federal government to support that center is dated to the end of this month. But because the center continues to be used, the team is seeking an extension to the service, which will be assessed, the need for it will be assessed on a month-by-month basis. And though we have seen a decrease in outbreak numbers, we continue to see outbreaks in institutional settings and workplaces, and we're continuing work aimed at preventing outbreaks through promotion of appropriate infection prevention and control practices with our partners at the regional IPAC hub. IPAC standing for Infection Prevention and Control. And so with respect to workplaces, the Ontario Ministry of Health defines a workplace outbreak as 2 or more lab-confirmed COVID-19 cases with an epidemiological link in the workplace. For example, the same work area or the same shift within a 14-day period where both cases could have reasonably acquired their infection in the workplace. This means that one person testing positive for COVID-19 or even multiple people testing positive in a workplace would not necessarily meet the definition of an outbreak. So as part of the COVID-19 case and contact management process, Ottawa Public Health communicates with every resident who tests positive to identify locations they might have visited while contagious. We obtain a list of close contacts and we provide information on measures needed to prevent any further spread of infection. The next step is to notify the residents who are deemed to be a high-risk close contact of someone who's tested positive and provide them with the information based on their individual level of risk. Ottawa Public Health investigates all reports of COVID-19 illness in workplaces, and we work directly with the individuals who've tested positive as well as with the workplace itself to determine the risk of transmission and the risk to employees and public health and safety. Santé publique Ottawa fait enquête sur tous les rapports des maladies liées au COVID-19 dans les lieux de travail et travaille directement avec les personnes qui ont été testées positives ainsi qu'avec le lieu de travail lui-même pour déterminer le risque de transmission et le risque pour la santé et la sécurité des employés et du public. Ottawa Public Health's COVID-19 daily dashboard contains all publicly
Dr. Etches, I'm going to ask you to pause because we have been able to make contact. And welcome to our meeting. And we're very much looking forward to you sharing your words and your prayers with us this evening. So I'm going to turn the mic over to you, please. Dr. Etches, back to you.
Sure, Kiana Mick. I was speaking about workplace outbreaks and how you can find information on our daily dashboard. The workplace outbreaks are noted at the bottom under community outbreaks. They're broken down by type of workplace and setting. And there's also anonymous outbreak specific data that are available regarding workplaces through Open Ottawa. And Ottawa Public Health discloses the name of a workplace when there's a known risk of exposure to the public and there's a lack of contact information, no other way to reach people. In these rare circumstances, Ottawa Public Health has used public advisories and the media to reach the wider public. And Ottawa Public Health only orders a premise closed based on a public health risk assessment when it's required to further investigate or address an ongoing risk to the public. I believe this has only happened once throughout the whole course of the pandemic. And this decision based on public health risk assessment is consistent with the practice of other public health units across Ontario. We do work to protect the privacy of individuals who've tested positive for COVID-19 as a top priority. And it's also important to maintain positive and working relationships with businesses as we rely on their cooperation from the owners, and that we know the general public needs to be able to have that confidence that we're following up on the details of close contacts identified in the workplace. So when it comes to workplaces and institutional settings, our role is focused on infection prevention and control practices and outbreak management. And regarding other types of working conditions and promoting health, members will recall that in our February report on the lessons learned from COVID-19, the board took a position on the issue of paid sick leave. And through that report, Ottawa Public Health and the Board of Health recognized the importance of a living wage, paid sick leave, stable employment, and job security in order to ensure that workers have safe environments and that they are able to stay home when sick, reducing the risk of bringing illness into the workplace. So speaking about outbreaks, the largest institutional outbreak in Ottawa last week was at the Ottawa Carleton Regional Detention Centre, though that outbreak has now been declared over. We work closely with the detention center on a daily basis, met with representatives of its outbreak management team, and employees and people in the center were provided with protective equipment as needed, and the facility was following the recommendations for the management of COVID-19 when there were symptomatic or positive staff and residents of the facility. We did lead an on-site vaccination clinic at the center during the week of May 17th for people, and we assisted in coordinating an additional staff vaccination clinic on June 12th. And it's the Ministry of the Solicitor General that's now working with provincial correctional facilities to provide residents with the ongoing opportunity for COVID-19 vaccinations, including newly admitted people. The ministry has continued to provide all frontline corrections staff with an online booking link from us to encourage them also to attend a community vaccination clinic. In addition, we've made some recommendations to the Ministry of the Solicitor General to establish practices that would monitor the ongoing vaccination coverage rates of staff and people living in the center on a weekly basis to guide on-site immunization efforts. So I'm going to switch topics again here. And just noting that this is the last Board of Health meeting before the fall, and some teams are slowly growing their capacity for non-COVID-19 related work. So I wanted to highlight some of the work that we're doing over the summer months, particularly with respect to mental health and substance use, and in preparation for the return to school. On June 2nd, the province announced that schools would remain closed for in-person learning for the remainder of this school year. And we know that those school closures have had a negative impact on the mental health of children, youth, parents, and caregivers. So that news was difficult for many to hear. But I am very hopeful that after a summer of carefully easing restrictions and the progress with our vaccine rollout, that we know that we'll be in for a successful return to school in the fall. Je garde l'espoir qu'après un été de levée prudente des restrictions et de progrès dans la vaccination, que les élèves, les travailleurs de l'éducation, les parents et les soignants pourront reprendre l'école avec succès à l'automne. So Ottawa Public Health nurses have been and they continue to work closely with our local schools and our school boards, as well as with community partners to support the mental health of children, youth, and education workers in various ways. The team is carrying out an assessment of the 2020-2021 school year, and they're identifying ways to ensure that people will have the information and resources they need to make the upcoming school year as healthy as possible. And I know the team is looking to present their findings to you in September And their plans include COVID-19 processes and protocols for people testing positive, their contacts, screening, testing supports, linkages and supports for mental health and substance use, and reintroducing the availability of some essential Ontario Public Health Standards school health services, such as school immunizations, healthy sexuality, dental health, mental health and resiliency programming, tobacco, vaping, and substance use programming. And in addition to working closely with the local school boards, we are planning with the Kids Come First Ontario Health Team, as CHEO and other partners in the team have advocated and are collaborating for the health of children and youth. And we want to thank these partners for their ongoing commitment and support. With our Kids Come First partners, we reached out and we asked local youth groups to share a 1-minute video describing how they are coping with the COVID-19 pandemic as part of our Your Minute video campaign. And the goal for this for youth by youth messaging was to inspire others and normalize their experiences by sharing stories and coping strategies while fostering hope and resiliency. There are youth groups that put together some wonderful messages that promote mental health and provide practical coping tips. So alongside our partners at CHEO, we'll be launching these videos this coming Wednesday. So I encourage you to check out our social media platforms on Wednesday to be inspired and help share these messages with youth and young people in your lives. With respect to mental health and substance use more broadly, I want to thank Member Menard for reaching out to Ottawa Public Health recently with an inquiry about overdose data in Ottawa and the topic of decriminalization of people who use drugs. Based on the latest available data, confirmed opioid overdose related deaths in Ottawa have approximately doubled from 65 in 2019 to 123 in 2020. And this is while suspected drug-related overdose deaths have increased by 75%, from 124 in 2019 to 218 in 2020. Opioid-related hospitalizations have also increased throughout 2020, and they are at levels alarmingly higher than what we were seeing prior to 2020. So board members and OPH team members, we know that each person behind these figures is grieved by friends and family, and we must do more to continue to prevent deaths due to problematic substance use. A May 2021 report published last month on behalf of Public Health Ontario and the provincial coroner and others provides more insights into this rise in opioid-related deaths, which is seen in almost all areas of the province over the pandemic period compared to 2019. The vast majority are accidental. And across Ontario, males, people 25 to 64, and people unemployed stand out as groups disproportionately represented in the statistics. Of people employed, the construction industry accounted for 29% of people dying from opioid overdose. And as well, although the vast majority of people dying were living in a private dwelling at the time of their death, that was 71%, the number of opioid-related deaths among people experiencing homelessness more than doubled in this time period to, in 2020, account for 16% of all opioid-related deaths in Ontario. So Ottawa Public Health's work to mitigate harms from substance use over the course of the pandemic included adapting our supervised consumption service to pandemic conditions, supporting supervised consumption services to stand up for people who were homeless and needed to isolate, and increasing access points for naloxone, coordinating implementation of a safer supply program with 5 partners to increase access to prescribed opioids where indicated. There was a lot of harm reduction work we were not able to advance as much given the context of the pandemic, and that included work with hospitals and primary care providers to better address stigma and increase harm reduction approaches across other institutions. And also our work with employers, including building connections on connections we have started with the construction industry, are still areas to further advance. And we've seen that the supervised consumption service clients' needs and challenges have grown, such that there are more comprehensive approaches that are needed to better support the complex mental health, substance use, and housing and social services needs. The board is aware that Ottawa Public Health has been working on systemic change that's required to reduce harms from substance through collaboration across organizations and sectors through the Ottawa Community Action Plan, and this was reaffirmed in 2020. The work last week at Ottawa Public Health shared was related to this action plan and making it visible on a website that's dedicated to that. So this was in partnership with the sponsors, the Community Addictions Peer Support Association, the Royal, the Canadian Centre on Substance Use and Addiction, and the Canadian Public Health Association. Is to continue to call people to work together to address the opioid crisis and highlight the foundations that have been established for this work. The plan is intended to be inclusive and ongoing and has been shaped and led by engagement with people from a broad range of backgrounds, agencies, existing networks, representing people with lived experience and expertise, Indigenous peoples, newcomers, visible minorities, women, LGBTQ+, and priority populations. The website demonstrates that the community has been involved in working together to provide various perspectives and expertise to drive actions on 3 key areas. The first is addressing stigma related to substance use. It still widely exists. The second is to provide access to harm reduction services in a broader and more innovative way. And the third is to create a more centralized and simplified way to access substance use and mental health services in Ottawa, integrated with social services. So actions have been implemented in these 3 areas over the last year, with significant progress on access to mental health and substance use supports through accessmha.ca, that's led by the Regional Coordinated Access Team, and is also for children, youth, and families through the One Call, One Click portal, which was recently launched by Kids Come First. These new regional coordinated access points are major milestones, initiatives that people have been seeking for a long time. However, behind the points of access, we also see that expanded services to meet the increased demand are also needed. Ottawa Public Health has been supporting a greater municipal role as the city services can help make a difference with respect to mental health and substance use, and including addressing some of the needed supports like housing. So this community priority will be advanced with this community safety and well-being work that the city is leading. And we'll continue as Ottawa Public Health to participate in those initiatives to try to align efforts for the greatest impact. And what we see is the community conversations that continue to inform new actions under each of the community action plan's 3 areas of focus. So decriminalization of people with simple possession of substances was not a top priority surface for harm reduction work identified at the 2020 summit, but the understanding is growing that decriminalization is an important contribution to addressing the stigma related to substance use. Stigma prevents people from accessing the supports they need. So harm reduction partners have planned a forum to flesh out recommendations specific to Ottawa on this subject at the end of the summer. And also on the topic of harm reduction services, this month, the Ministry of Health released an updated consumption and treatment services compliance and enforcement protocol. It's required under the Ontario Public Health Standards, and it will require Ottawa Public Health to conduct inspections and post the results for all supervised consumption services and consumption and treatment services in our jurisdiction. It'll be on an annual basis and based on complaints. And the ministry will identify a body responsible for inspecting Ottawa Public Health's supervised consumption service. This is a new accountability for Ottawa Public Health, and so we'll be working with partners to make clear the provincial expectations for sites, including extending to a 15-meter perimeter around sites. As the Ottawa Public Health Board assisted with a culture shift from viewing problematic substance use as a crime towards understanding this health condition, and Ottawa Public Health assisted with the community conversation about how supervised consumption services are one element of the supports needed to address problematic substance use, Ottawa Public Health will bring information forward to the board to consider their role on the subject of decriminalization. We are committed to the meaningful involvement of people with lived and living experience as part of this ongoing dialogue and throughout all phases of drug policy reform. Broader community engagement and consultation will also play an important role to address questions and concerns, such as are still arising related to supervised consumption services, and to build solutions. Addressing stigma and discrimination related to substance use and expanding access to harm reduction, mental health, substance use, and social services relevant to our local context and needs are crucial components of the required response. So all areas of the Ottawa Community Action Plan must be advanced to significantly reduce the loss of life from overdoses and promote healthy communities. There is no question that the pandemic has increased the demand and need for mental health and substance use programs, resources, supports, and services more broadly, beyond addressing opioid and substance use disorders. Therefore, despite our staffing and resource challenges as we try to respond to the pandemic, we are continuing to work with other partners on school mental health work with hospitals, community health, workplaces, the racialized community, and we'll continue to look to update our action plan for the strategy that you approve on an annual basis. And so to inform new actions under this board's strategic priority for substance use and mental health, we'll continue to build in the input from community over the summer and bring you recommendations in a September report. So lastly, I will speak to the recovery efforts. We're continuing to see vaccine coverage rates grow, and we're looking ahead to the future. Alors que les réponses à la pandémie et les taux de couverture vaccinale pour la COVID-19 continuent de progresser à Ottawa, Santé publique Ottawa se tourne vers l'avenir. So we've started recovery planning for the organization, and it will be informed by employees and partners and yourselves. We have a goal of building a stronger, sustainable local public health system that collaborates across health and social sectors. And so it has three components: to rejuvenate and support employee wellness, to restore, prioritize services and programs while supporting the community to recover from the pandemic, and to reimagine, to identify opportunities to strengthen Ottawa public health programs and services and processes into the future. There are still many unknowns. We don't know exactly the way in which Ottawa Public Health will meet its mandate moving forward. It will likely look different post-pandemic, as many teams have already changed the way they do things. We'll build on the relationships that have been formed, the lessons learned from the pandemic, and identify new opportunities. We're going to stay focused on health equity, particularly for Indigenous, Black, racialized, newcomer, and low-income populations. We'll stay focused on collaboration, innovation, and developing a sustainable health and social service system. And I want to bring you an update that relates to our strategic plan report. Well, many employees are still operating under ever-changing circumstances. We see the critical need to focus on employee wellness, and we have just received the results from spring survey on employee pulse check. And these results were compared to the fall survey the city did, and Ottawa Public Health included. And we see that there are some improvements where significantly more employees feel supported by their leader, and they feel that their leader embodies servant leadership behaviors more than they did in the fall. Most employees feel supported by the leaders and that they have the tools that they need. And employees who feel supported by the person they report to, or who have regular coaching and feedback conversations, are clearly doing better than employees who aren't. So we've identified, though, the areas of action which need to address that general well-being has deteriorated for almost half of employees since the pandemic started. And work demands have increased for 83% of employees who continue to report challenges with workload. And the program managers and managers in particular are reporting deterioration of their general well-being, managing work-life balance, being extremely or very concerned about their mental health and feeling overwhelmed. This dates back to March. So consequently, I would update the report from you, which was gray because the results weren't in. I would suggest that we need to indicate that this is best coded as red and an area that needs ongoing attention. The senior leadership team is meeting with managers to identify actions that can continue to make a difference in their well-being. There are good practices that are being advanced, and we're working to update our wellness at work plan to address the concerns identified, including workload and also communicating about the future workforce plans as soon as we have more clarity. People are looking for clarity about their futures. So over the summer, we'll need to continue to focus on COVID-19 immunization and case and contact management, outbreak management. We want to enable transmission again to be as low as possible as people get back to work and the supports they need. And then we're working with our partners to identify what work will continue over into the next year. So there are catch-up areas of work where we will need employees to continue to be with us and help us with additional work. And we know that over the fall, we are working to restore some of the mental health, substance use, dental, healthy growth and development, and immunization work. And so these programs will be further stood up. And as we go into 2022, we know that there are still unknowns, but we will have more time to put towards reimagining our work into the future. There are lots of elements that are at play here in terms of how our local health partners are working, the municipal and provincial and national conversations about post-pandemic needs. And so we'll continue to engage with partners to shape our work. And before too long, we'll be meeting with you again to look at how we update the action plans under our strategy. So I'm going to stop there. I know it was a lot of different subjects today. I am happy to take your questions. Cela conclut mon rapport verbal et il me fait plaisir de répondre à vos questions.
Thank you very much, Dr. Etches. And yes, there were a lot of subjects, but there are a lot of things that we needed updating on, so much appreciated. Before we do get to questions from board members, though, we have a number of delegations in relation to your verbal report. So we'll start with those first. I remind all the delegations that you have 5 minutes to make your delegation. And the first person on our list is Mr. Sam Hirsch, who is here, I believe, on behalf of Horizon Ottawa tonight. Good evening, Mr. Hirsch.
Hi, Councillor Aguilera. Can you hear me?
Yes, I can.
Wonderful. Okay, we'll start now. Bonjour et merci. Premièrement, je voulais reconnaître que nous sommes sur le territoire non cédé du peuple algonquin et aujourd'hui et toujours, nous devons être engagés à décoloniser notre ville. Et ça veut dire aussi nos bureaux de santé publique et toutes les institutions municipales. Nous devrions non seulement avoir de la bonne rhétorique par rapport à nos communautés autochtones, mais aussi des vraies actions pour améliorer leurs conditions de vie. As was said, my name is Sam Hirsch, and I'm speaking today on behalf of Horizon Ottawa. Excuse me. And while we're talking about improving material living conditions for folks across the city, there is one demographic in particular that have had it particularly hard, and that is precarious essential workers. In our city alone, there have been close to 1,000 confirmed workplace cases, 149 workplace outbreaks, and 6 deaths. But it's hard to know that because the data is inexplicably buried pretty far down the Ottawa Public Health website. I only knew about that a couple of days ago, or a couple weeks ago, rather. One business in particular that has escaped accountability is the Amazon facility in our city's East End. Last month, it was revealed that, as was mentioned earlier in this meeting, that the Amazon facility in Ottawa's East End has seen dozens of cases since the beginning of this pandemic, but most of the folks around this table have ignored that fact. Detailed firsthand accounts from a warehouse worker describe an unsafe environment where the employer was not enforcing or following necessary COVID-19 protocol, yet they still passed an investigation. According to the employees, there had been as many as 35 cases in the warehouse, with a dozen COVID alerts in January alone. But no one knew about this because Ottawa Public Health is arbitrarily refusing to name businesses like Amazon, despite there being no rule hindering him from doing so. On top of this, OPH refused to confirm the 35 number. Workers deserve better, and not only workers, but residents deserve to know where the cases are coming from. In a response to a letter Horizon Ottawa sent to Dr. Etches about standing up for precarious essential workers, like those in the Amazon facility, and holding businesses to account, you responded with, among other things, and you repeated this again earlier in this meeting. It is important for OPH to maintain positive and trusting relationship with businesses, as a health unit relies heavily on the cooperation of business owners and the general public to provide details about close contacts during the case management process. And what this quote frankly says to me is that you are placing the potential of causing a minor inconvenience to a large corporation over the safety and well-being of hundreds of low-wage precarious workers. To the members of the Ottawa Public Health Board and Dr. Etches, I ask, whose side are you on? A lot of these workers do not have the capacity to stand up for themselves. They don't even have the backing of a union and are relying on Ottawa Public Health to do it for them. So to hear that you don't want to up protections or be more strict because you want to maintain a more collegial relationship with a large corporation is quite frankly doing these warehouse workers and workers across this city a disservice. A constant argument from OPH has been the importance of protecting privacy of individuals who have contracted COVID-19 and inappropriate disclosure. But the argument isn't about protecting the privacy of individuals. Of course, we agree with that. Their personal privacy should be protected. The real argument, though, is holding businesses who do not follow COVID restrictions and force their workers to work in unsafe conditions accountable, like Amazon did. And workers have confirmed that those took place and that there were those cases. I know perhaps, as you mentioned, that they may have passed an investigation, but that does not mean workers were not subjugated to extremely problematic working conditions and continue to be subjugated to these working conditions. They didn't speak out to you because they were afraid of losing their jobs. We need an Ottawa Public Health that stands up for everyone, especially for workers. But the fact of the matter is that you are putting the economic interests of businesses ahead of the well-being of their employees. An unsafe workforce will not make this reopening go any smoother. We shouldn't have to rely on precarious, low-wage workers taking a risk to approach media and putting their job on the line to know when outbreaks are happening in workplaces in this city. That's unacceptable, and that should be unacceptable to everyone on this board, and you as well, Dr. Etches. Workers are suffering, especially in that facility, and something must be done about it. The unnecessary hesitancy and bowing and scraping to economic interests at the behest of worker safety must be put to an end. Like I said last time I spoke here, Dr. Etches and our members of our Board of Health, it may be uncomfortable to go against the province or business interests in the city, but being a political representative and a top bureaucrat in our city means taking positions that will help those you represent. And sometimes those decisions require you to be a bit uncomfortable. Workers are counting on you, and your community and residents are counting on you as well, so that they know how to stay safe during this crisis. Thank you.
Right on time, Mr. Hirsch. Thank you. Are there any questions for the delegate? Okay, seeing none, I would like to call on our second delegation, which is Bethany Leonard, who's appearing on her own behalf tonight. Bethany, can you hear us?
Can you folks hear me okay?
Yes, we can, Bethany.
Okay, great. 1 second here.
Over to you for 5 minutes.
Okay, sorry. Okay, I'm here to add my voice to the call for the Ottawa Health Board to release information to the public regarding workplace outbreaks of COVID, especially at facilities with large workforces such as Amazon, Superstore, Walmart, Canadian Tire, Costco, construction companies, and more. I understand the intention in keeping the information private is to prevent workers from being stigmatized. I assure you the lack of transparency only helps with the harmful pattern of employers not needing to be accountable for the health and well-being of their employees. If corporations don't have to be transparent about workplace outbreaks, this means they also don't have to answer it to the public when it comes to unlivable wages, lack of paid sick leave, and unsafe working conditions. You are essentially denying the public information they need to address the continued inequities of our labor system. I understand outbreaks can still happen in facilities who have worked hard to be compliant with COVID safety measures, and that is why information going public is so crucial to community awareness and education. Most workplace outbreaks I've been informed of have come to me through the neighborhood grapevine as opposed to Ottawa Health, and that doesn't seem right. When I hear of these workplace outbreaks, I know the workers aren't at fault. They are working under a system that devalues them and the environment, and it is the system that needs transformation, and that is where you come in. So I'm asking you to, one, simply release workplace outbreaks with over 20 workers, just as other cities have done, like Toronto and Hamilton. And two, as mentioned before, please keep pushing for paid sick days. Don't stop until it is put in place permanently. The program announced by Doug Ford is simply not good enough and ends in a few months. It is not right for people to be unable to support themselves and their families because they are sick. You know this contributes to mental health crisis when people are working constantly, sidelining their health and well-being to make ends meet. So please, I know you all saw the importance of this as a result of the pandemic when you issued a letter urging Doug Ford to act on this fundamental need. But the pandemic ending does not change the urgent need for paid sick days. And so I urge you to not stop until real change happens. In closing, the bottom line is the secretive approach to disclosing outbreak information breeds more distrust in our organizing and government bodies. You are meant to help protect every individual living in this city, and by not holding employers accountable, especially multi-billion-dollar companies like Amazon that don't even contribute taxes, you send a message that you care more about the distribution of brown boxes with fake smiles on them than the people who have to spend their precious life minutes packing those boxes to be able to pay for basic needs. Thank you so much for listening today.
Thank you for coming out today, Bethany. Okay. Seeing none, our next delegation is two presenters on behalf of one organization. So Aaron Moore and Justin Pichet are here on behalf of the Criminalization and Punishment Education Project. And collectively, you have 5 minutes. So over to you.
Thank you, and thank you for the opportunity to speak at today's meeting. My name is Aaron Moores, and I'm a lawyer here in Ottawa. I'm here with Justin Pichet, who is a professor in the Department of Criminology at the University of Ottawa. And we are members of the Criminalization and Punishment Education Project, or CPEP for short. This is a group of current and former prisoners and their loved ones, a group of professors and students, and a group of other community members and advocates. We do research and advocacy to reduce criminalization and incarceration in the short term and pursue abolition in the long term. Our work includes, among many other things, a hotline for people incarcerated at the Ottawa Carleton Detention Centre, which is called the Jail Accountability and Information Line, or JAIL for short. About a month ago today, a COVID-19 outbreak was declared at the Ottawa Carleton Detention Centre. Dozens of prisoners and several staff members have contracted COVID, and it's been the largest outbreak at the Innis Road Jail since the pandemic began. But the impact goes far beyond just those who contracted or will contract COVID. The entire institution was on lockdown for weeks. And when we say lockdown, we mean torturous conditions, and we're not using that word lightly, in the sense that prisoners were confined to their cells, and some still are, for 23.5 hours per day, with no access to yard, fresh air, programs, visits, and in some cases, even reading material. According to callers who called the jail hotline, a number of units remain on this type of lockdown, although they have been lifted in some units that do not have cases.
Thank you for allowing me to speak today. This event on unceded and unsurrendered Algonquin territory, where Indigenous, Black, and other racialized people are mass incarcerated in contrast to other populations in the city. This didn't have to happen had the province taken more measures to divert and decarcerate prisoners to reduce the risk of COVID-19 transmission. And had Ottawa Public Health moved to vaccinate and incarcerate people at OCDC earlier than May 18th, with adequate access to information to ensure informed consent and address vaccine hesitancy. I emailed Ottawa Public Health and CC Dr. Etches in late March to recommend measures to address vaccine hesitancy at the direction of jail hotline staff and volunteers who were hearing from incarcerated callers who had concerns about taking vaccines once they'd eventually become available to them. We were ignored. Several prisoners remained hesitant to take the vaccine, and in combination with a late vaccine rollout, an outbreak took place for which Ottawa Public Health needs to be accountable for in terms of its role in it. However, right now we need to focus on reducing the risk of COVID-19 transmission behind and beyond bars in order to prevent a fourth wave in the city. There are many reasons for vaccine hesitancy amongst incarcerated people. Many behind bars have had poor experiences of healthcare owing to discrimination because of the color of their skin, poverty, or the stigma around the health issues they are seeking care for, including drug use and mental health issues, which were also addressed during this meeting today. Many behind bars have been mistreated and abused in jail and don't trust what jail management and staff tell them, even the jail doctor and nurses in some cases. Many behind bars are aware of prisoners having been used for scientific experiments in the past, and Canada has a history of that as well. Many behind bars have underlying health conditions and are deeply concerned about the impact a vaccine could have on them. But unlike you and me, all prisoners lack access to basic information those of us in the community have access to in order to make informed decisions where vaccines are concerned.
So it really is critical that OPH ensure that incarcerated people have access to information and people they trust, including professionals they trust, to get their informed consent and close the vaccine gap around hesitancy. And those written materials like pamphlets are important, but they're static documents and they don't provide the same reassurance and comfort as being able to ask questions one-on-one with someone that you feel trust for. And we need to keep in mind that literacy is an issue for some prisoners. Ideally, Ottawa Public Health and OCDC could do what's happened in some Toronto area jails where trusted community members, including some with lived experience of incarceration, enter the institutions to provide information and answer questions in a confidential manner one-on-one with appropriate health precautions in place. And you spoke, Dr. Etches, earlier of having made recommendations to the Ministry of the Solicitor General, and we do hope that you will advocate for this kind of thing going forward to reduce vaccine hesitancy and protect the people at OCDC. Thank you.
I want to thank you both for coming out tonight, and to your last comment, Chandra, that's correct. A letter did go out today from Dr. Etches, which I was privy to the preparation of, asking for steps to be taken, absolutely, and that's something that we take seriously, and that's why the request has been made to the ministry to follow up on that. So thank you both for coming out tonight. Are there any questions for the delegations? Okay, thank you. Next on our list is
those two people with their mouth up, Chair.
Oh, I'm sorry, Sean. So Elise first, and then Sean. Thank you, Sean, for pointing that out.
No problem, Keith.
Hi, thank you very much for your presentation. I think it was very enlightening. I'm just wondering if Dr. Etches or maybe our delegation could talk a bit about the incarceration for the 23.5 hours a day that you spoke of. Obviously, I have a feeling that the idea was to prevent further contractions, but obviously we've talked a lot about how we need to balance measures of trying to avoid transmission with, mental health and other supports, and we talk about that in the context of the general population. But if we kind of lead with the idea of thinking kind of what happened to people and really leading to where we are at with this distrust, et cetera, that only furthers that feeling of distrust. So I'm wondering if, I know Dr. Etches, it's not necessarily a responsibility for those measures in terms of jurisdiction, but I'm wondering if you could talk a bit about perhaps how to balance that, or maybe it is our delegation who could better answer that.
So generally speaking, Member Banham, at this point, the questions would be directed to the delegation, and then questions for staff once we've dealt with all the delegations. And that's to recognize we have other delegations that want to speak to us as well. So is it okay if we split it that way? If the delegation speaks to your question, and then Dr. Etches and the team can speak to it when we get to staff questions? Is that fine?
Yep, that's great. Thank you.
Okay. So Justin or Aaron, I'm not sure who wants to take that, or maybe both of you want to comment.
I can start. So just to say that, like other congregate settings, prisons have been heavily impacted by COVID-19 throughout the pandemic. To date, across the country, there have been almost 7,000 prisoners who have contracted COVID-19. The rate of transmission in prisons in Canada compared to the general population is roughly 6 times that behind bars versus in the general population. Over 2,100 staff members across the country in prisons have contracted COVID-19. So there's been, well over 9,000 cases of COVID-19 linked to our jails, prisons, and penitentiaries so far. And in Ontario, it's around 2,200 cases where roughly 1,700 prisoners and over 500 staff members have contracted COVID. So it's a serious problem that requires a serious response. Now, to answer the question about the lockdowns during the course of the pandemic, newly admitted prisoners usually have spent 14 days in a quarantine range where they face these kinds of lockdown conditions, so that authorities can make sure they don't have COVID going in and then spreading it throughout the jail when they're moved on to other units. And then when COVID is suspected or detected at a jail or a prison, then that's when you see medical isolations happening, where people are isolated so that they can plan further action. And then, of course, the lockdowns throughout facilities. And yeah, I mean, basically what we're talking about here is segregation or solitary confinement being enacted in the name of public health. And it's obviously something that is fairly unique to prisons that you may not see in other institutions, although we understand that there's other congregate settings that residents have been subject to similar torturous conditions. So I mean, this is being done in the name of keeping people behind bars, in the name of public safety and public health. Meanwhile, we have to keep in mind that most prisoners eventually return to the community, and they're being damaged and harmed right now. And when they come back, having been harmed by all this, that has that reverberates for them, their mental health, their families, and of course our communities. So we need to do what we can to contain COVID, not people, to the extent that we can, and to ensure that we address the vaccine hesitancy that's currently going on, because it will just continue.
Thank you for that response. And as I say, when we get to staff questions, Dr. Etches and the team will have an opportunity to speak to that issue as well. Member Menard, Member Bannon, was that all of your questions? Thank you. Member Menard, please.
Thank you very much, Chair. Thank you for being here. I think it's a good presentation, and Justin, I had read your article as well on this previously, and some of the efforts of people like Michael Spratt as well that have outlined this issue really when the pandemic began. This has been known for a long time, so it's bewildering why the province didn't act earlier when this information was there and available. One thing that did occur, and I want to know more about this if you can explain it, is there were some alternatives to the caging of these individuals during the first wave, and there was some, I believe, separation that occurred there, and some of the mitigation factors that happened. So what was that occurred? Is that a viable tool now? And what can we do more to to continue to put pressure on the province to enact the changes you're calling for?
So during the first wave of the pandemic, the province of Ontario reduced the population of its jails and prisons by over 30% within the span of a few weeks. That happened for a variety of different reasons. Police were, using discretion more, releasing more people on their own recognizance instead of having them detained pending a bail hearing. Prosecutors and defense attorneys were engaging in more bail consent agreements, and where those agreements couldn't be secured, judges and justices of the peace were more willing, because of the risk of COVID, to release people with conditions in the community pending their trials. And then on the back end of the system, you had measures like temporary absences being used for people serving weekend sentences, people who live amongst us during the week and with their families for 5 days a week to work, and then they go and report to the jail over the weekend. I believe that's still being used right now. And then to a lesser extent, some earlier releases on parole, although nowhere near to what they could have done, especially had they accompanied those diversion and decarceration measures with investments in the community around housing and income supports to ensure safety for folks. So lots of things were happening during that first wave. I know OCDC didn't have many COVID cases during that first wave, like many other jails actually across the province. And indeed across the country, and those efforts were not sustained. The population at the Ottawa Carleton Detention Centre gradually went up. We know, for instance, during the first wave, at one point, OCDC had around 300 prisoners. It's a 585 bed facility, of course, with double and triple bunking and cells originally built for one person. So it's still crowded, even though it has like 300 people in at that point. But then, those numbers went back up. And when this most recent outbreak happened, I believe there was around 400 incarcerated people in there. So, some of the things we were doing during the first wave haven't been sustained, and, where people are living the consequences for it, both folks who are held there in prison and folks who work there who return home to their families and to our communities and shop in the same stores that we shop in and day out. So, nothing that happens behind bars stays behind bars. Can have an impact and reverberations for all of us, which is why we all have an interest in doing what we can to reduce the prison population, which is generally an ineffective, unjust approach to dealing with criminalized acts to begin with. We know that we could be doing a lot more prevention wise and investing in things like housing, when nearly a quarter of our prisoners in Ontario are homeless and cycling in and out of homeless shelters and prisons, but we're not doing it. It's hard to explain why. I guess it doesn't get enough votes, but
well, I appreciate that, and that's a helpful explanation as well, and kind of the dire circumstances that still exist there. And Aaron, I wanted to just ask you, I heard the chair say that Dr. Etches and Public Health will be writing to the province based on the letter that you had sent us, so that is good to hear. Are there more items, more actions?
Member Menard, it's actually been done, and the board secretary has circulated the letter to all of you. The letter has gone out.
Okay, fantastic. And I just wonder to Aaron, is there more, just to finish my question, Chair, is there more that can be done that you're looking for beyond a letter?
I can answer. I haven't seen the letter. I just learned about it when Dr. Etches mentioned it earlier. So I don't know what the recommendations were, other than what Dr. Etches mentioned, which was that there was some sort of recommendation for tracking vaccination rates at OCDC more on a more weekly basis, so perhaps more often than they've been happening right now. But I think what we would really like to see as members of CPEP, and in particular, Professor Pichet has a lot of contact with folks who are incarcerated and their families, is really a strong advocacy approach from the city about getting trusted people, as we said, into the prisons, into the jails, into OCDC, listening to what formerly incarcerated people and incarcerated people have to say about who they would listen to. Who do they need to talk to be able to be convinced of the safety of these vaccines? Because they just don't have any, like they don't have internet, right? Just to start with, so many of us can go Google whatever we want if we want to know what's the difference between Moderna and Pfizer. There are community organizations out there setting out lots of interesting information in simple language in 15 different languages. Cowie in Ottawa, the City for All Women initiative, has been doing that really well, getting people to understand and opening up those opportunities for confidential discussions with trusted people. The healthcare practitioners in jails are not typically trusted by prisoners, so it has to be someone else. Who should that be? Well, that's what you have to talk to prisoners about, and formerly incarcerated people, to say who are the best people to go in. And I think often, and Professor Piché will correct me if I'm wrong, often there has to be someone with lived experience involved in that process. And it certainly has to be with somebody who is not also part of the jail structure that is keeping the person in the cage. So someone who's working within that structure. So I think what we'd like to see is, in the same way, Dr. Etches, that you talked about doing all these what sounded like wonderful partnerships with Indigenous groups, with racial justice groups, with groups advocating for Black people in Ottawa. It sounded, you talked for a long time about all of these partnerships you had and all of the ways you were trying to prioritize vaccination and the health outcomes for these particularly vulnerable groups, including also that intersection you talked about of race, immigration, and low income. Well, a lot of the people in OCDC match that description. And I don't think they were treated with the same priority. So that's what we're looking for too, is that same advocacy, as Professor Piché said, for people who live in our community but happen to be behind bars, as we applied to others outside bars in Ottawa.
Thank you for that, and I appreciate those comments. I've just sent you what we received just at 6:40 today on that letter, so you should hopefully have that now. And I very much appreciate your comments and Professor Piché's comments as well. Nice to see you. Thanks for being here.
Yes, thank you both for coming tonight. I don't see any other questions for you though, so thanks again. And move on to our next delegation, which is Chandra Pasma. Chandra, can you hear us?
Yes, can you hear me?
Absolutely. Over to you.
Thank you, Chair, and good evening, everyone. My name is Chandra Pasma, and I'm a resident of College Ward. And I'd like to thank you for the opportunity to speak to the Medical Officer of Health report tonight. I'd like to begin by thanking Dr. Etches and all of you for your hard work over the past year in responding to the pandemic. I know it has been far from easy. I'm sure you're exhausted, and I want to thank you for all the work that you've done. Unfortunately, our provincial government has not made things easier for you by taking swift action on paid sick days and workplace outbreaks. We know that one of the largest sources of COVID outbreaks in Ontario has been workplaces. We owe a significant debt of gratitude to the many workers who have continued to go into workplaces throughout the pandemic to ensure that we still have food and healthcare and other essential services. But it's not enough for us to just say thank you or to call these people heroes. They need and deserve protection from COVID while at work. We know that COVID can be a deadly disease, but the impact of COVID is not just in mortality rates, it's also about morbidity. My own family got sick with COVID-19 in March of 2020 and continued to experience painful and debilitating symptoms for many months. Thousands of people across Canada are dealing with life-altering symptoms after a COVID infection, however minor the initial infection may have been. Most of them were healthy before getting sick, but many of them may never return to full health again. Many are struggling to return to work and have no idea how they are going to support their families moving forward. It is unconscionable that we would expose anyone to COVID-19, no matter their age or their health conditions. Yet failing to ensure that workers have adequate protections in the workplace, failing to provide them with paid sick days, and failing to close down workplaces when outbreaks do occur does just that. It also exposes our wider community to risk when these workers take infections home and pass them to family members. We also know that workers who have continued to go into workplaces throughout the pandemic are more likely to be racialized, and evidence from the US suggests that racialized and Indigenous people may be more likely to experience long COVID after an infection. Other public officers of health have stepped in to address the policy failures of the Ford government. They are ensuring that employees are properly informed when an outbreak occurs. They are carefully monitoring the actions of employers and taking action to close down workplaces when COVID protections are not being followed or when outbreaks occur. They are providing transparency to citizens about where outbreaks have occurred and what measures have been implemented to protect workers and to protect the community. For instance, Peel Public Health shut down 3 Amazon distribution centers when outbreaks occurred there. Toronto Public Health closed or partially closed at least 16 workplaces due to outbreaks and publishes a list of all workplace closures on its website. I urge you to show the same leadership as your colleagues in those jurisdictions. Workers in Ottawa deserve no less protection than those in Toronto or Peel. Please step in and fill the void left by the Ford government. Without action, workers are left to live in fear, taking whatever steps they can on their own to protect themselves and their families, or risking their employment by approaching the media to try and generate public support for the protections they need. Please, please, let's support these workers. Let us get to the end of the pandemic and safely through this period of vaccination without a new wave or the spread of variants throughout our community. Keeping workers safe keeps us all safe. Thank you, and I please entreat, please take action.
Thank you for coming out tonight. I see Member Menard has his hand up.
Thank you very much, Chair. Thank you for being here, Chandra. Nice to see you. I think one of the points being made by Ottawa Public Health is around you know, the identification of businesses potentially leading to a lack of reporting. That if they're feeling like they may be broadcasting who the business is, that may lead to them not voluntarily providing the information about cases or contractions of the virus of individuals in their workplace. So I don't know if I'm fully getting that right, Dr. Esches, based on the Friday memo, but I think it's close on some of the reasoning why they're saying we may be different than Toronto, what Toronto is doing and what Peel is doing. And so I just want your own take on that. I'd like to hear, you know, what your response would be to that, that one of the points that was being made anyway, that we've been receiving.
Thank you for that question, Sean. Employers have a legal obligation to provide a safe workplace to their employees. And part of that legal obligation is to inform public health when there is an outbreak. And I am sure that Ottawa employers want to abide by their legal obligations just as much as Toronto and Peel obligations. And I'm not sure why we would let them off the hook simply because reporting might result in some public transparency. I think transparency is better for employers, it's better for workers, and it's better for the communities. And we've already heard via media reports that employers are not necessarily being transparent with workers in the workplace, and not all workers are finding out about outbreaks in their workplace. So I think it's really important that we have as many sources of information as possible for these workers and for the public so that people can make decisions that help to keep them and their families safe.
Okay, thank you for that. Thanks, Chair.
Thank you both to Member Menard and to the delegation as well. I see Member Kavanaugh has a question as well.
Thank you very much, Chair. Thank you, Chandra, for coming out today. I just wanted to know, in terms of comparing us to other public health units, what kind of scale were these outbreaks that were reported? Because I don't know in terms of what is being what is being said about the ones here, but in terms of what is it different, and what kind of information were they using?
Well, it's difficult to compare because we don't have anything other than the media reports on the outbreaks in the Amazon distribution center in Ottawa, but they certainly seem comparable to the outbreaks in the Amazon distribution centers in Peel. And I think part of allowing citizens to understand what measures are necessary and whether the appropriate steps are being taken is transparency on how many cases are taking place within a workplace.
Okay, so we're not clear on the scale, or we're going by media reports at this point. Okay, thank you.
Thank you very much. I don't see any other questions, so thank you, Chandra. And our next speaker is Megan Winton. Good evening.
Good
You have
evening.
5 minutes.
Thank you. Thanks for having me today. Before I start my actual presentation, I just want to make 2 quick notes about the accessibility of these meetings. Once again, this is an OPH meeting that has failed to have captions, which I think we should do better at. And second, it becomes increasingly challenging to have a 5-minute delegation when we only have these meetings quarterly, as opposed to how other boards operate, such that it would be difficult for me as me to cover and respond to everything and ask all the questions that I have today in the 5 minutes that I'm given. So now we're gonna go for it. I am a PhD candidate and disability data and institutionalization researcher. I'm here to talk about a few things today, and I'd like to add my name to the long list of folks who are demanding and requesting that workplace outbreak data be published. I have been counting workplace outbreaks across Ottawa for the entire COVID, and it's incredibly difficult to track. And I often have to point people to where it is on the website because it is buried under things that presently don't have very many outbreaks. It also doesn't show the sum total. So for instance, you can't actually, you have to aggregate the data on your own to know how many total outbreaks there's been. But I'm going to talk about another piece of data failure that OPH has continued to deliver. More than 1,200 people live in residential service homes in Ottawa. These are large-scale institutional environments for 98% disabled people. Despite this, there has been limited disclosure of information regarding outbreaks in these institutions. Compared to long-term care homes and retirement homes, where we have published the names and the size of the outbreak and the deaths, whereas with residential service homes, which are operated by the province, or which are standardized by the city instead of by the province, we don't have that information. These are still run by corporations. These are still run at a for-profit level. And yet we are failing to hold these organizations accountable. The largest, I assume, outbreak at one of these residential service homes was at the Edgewood Care Center. This is a for-profit corporation that is based out of Nova Scotia. Where are they being held to account? We don't know. Along these lines, I think it's important that we demand to know what is happening in our residential service homes that these outbreaks are happening, and what are the conditions during outbreaks. Residential service homes, you might not know, can have up to 170 people, but only require 1 accessible bathroom for a 98% disabled population. Now, thinking further, we're in the midst of COVID-19, there's an outbreak at a domiciliary hostel, and it's been 36 degrees. There is only required in Ottawa's standards that there be air conditioning in a single room that can house 25% of the population. So that means people are living in triple or quadruple occupancy rooms and unable to get access to air conditioning and unable to leave their room because of outbreaks. I think that this is incredibly concerning. And as we've heard in long-term care homes, it is incredibly important to have access to air conditioning. As we continue to fail to bring air conditioning to our elder and disabled kin, this is allowing for them to, number one, be sick and ill from the heat and its impacts. And number two is that we don't have any information about what happened in these settings. We, according to the standards, there needs to be an investigation following serious incidences. We don't get to know about that. Unlike retirement homes and long-term care homes, we have no idea what happens from an inspection into a domiciliary hostel. Yet 1,200 people live in these institutions, and so many of them have had COVID outbreaks. I'm requesting that this information be made public and that this conversation about data really inform us going forward. It's quickly, adults with developmental disabilities, we've known since December that they're at increased risk of COVID-19, the highest risk. And there's an incredibly high presence of people with intellectual and developmental disabilities in residential service homes. We are putting these folks at risk, and we are failing to hold corporations accountable for the deaths that they have caused and the conditions of solitary confinement that they have experienced. Thank you.
Thank you, Megan, for coming out tonight. Member Menard has a question for you.
Thanks very much for being here, Megan. Nice to hear from you. I am wondering about, next steps, because we're finding ourselves in June. Trying to manage what has become the tail end of a third wave and not move into a fourth wave, but we don't know how that will be, if that'll be effective or not. So here we are. So in an ideal world, and in the circumstances that are presented in front of us, and you mentioned residential services homes, what steps would we take? What should the health response be? When it comes to people at risk in Ottawa, in these homes in particular, what are the main things that you would be asking for?
Yeah, so that's a great question. Thank you for asking it. I think that the first thing that we need is, again, it's going to be the hottest summer. We're in the midst of extreme global heating, and people only have access to air conditioning when they're congregated. And so inside, in a tight space that can only fit 25% of them. So, I mean, if we want to stamp out a fourth wave, then we need to install air conditioning, or at least cooling in more than one room in these settings. It is completely impossible to self-isolate or to have social distancing within these settings because of how small they are. So even looking at the fact that we still use triple occupancy rooms in our residential service homes, that is so risky. And the province's response to that was that residents should sleep head to foot. And so, these are things that just show how apparent it is that we do not care about our disabled community, and that we don't care about people who are institutionalized. Now, air conditioning, I think, is a really important first step. A second step that is incredibly evidence-based, you can look at STAL AL 2020 and 2021, which identify the variable, or the significant variables that impacted COVID deaths in long-term care. And one of the major indicators was, number one, profit status, number two, the number of people in rooms and bathrooms. So in these settings, 170 disabled people ostensibly are living in these settings, and there's one accessible bathroom. That is going to cause an outbreak. Number two, having 3 people to a room is completely putting disabled people at risk, and at higher risk of having a severe outbreak, and a severe outbreak in the community. So, I mean, those are really excellent first steps. We've had them outlined. And then that brings us to the third step of, we need this information disclosed. Why are retirement homes being held to account, but residential service homes aren't? Is it because people pay for retirement homes, and residential service homes primarily house a homeless and disabled population? I can't say for certain, but it does seem to have an air of ableism and perceived, that's it. It is. I'm sorry. And the last thing I'm going to say quickly is that we need this information, and we need these inspections to have happened so we can figure out how this has happened. So, yeah.
Those are very tangible, practical pieces of information. Thank you for that.
Thank you. And Member Kavanaugh, please.
Thank you, Chair. Thank you, Megan. You were talking about Edgeworth, Edgewood. Edgewood is one of them. Okay, I'm looking at their website. They say they have central heating and air conditioning. Not that that matters, but that's what they say. But is there any other? Are there any other public health places that are looking into these institutions, these places?
Yeah, so certainly some of these residential service homes might have air conditioning, but the dominant number of them, well, many of them do not have central air, particularly the ones that are in older buildings, which are having also have poorer air quality and so forth. Other jurisdictions have certainly reported on the cases within them, mostly disaggregating some of the data. Currently, our data is disaggregated into supported independent living, which is largely residential service homes, and group homes. But group homes is perhaps the largest chunk because there's so many different types of group homes. So we don't know how COVID spread within group homes. So for instance, in group homes for adults with developmental disabilities, the provincial order was such that people can work in multiple homes as long as they're in one corporation. And so how did that impact COVID rates across? And so lots of other jurisdictions have named those places, especially if they're chains and those larger homes. So for instance, Participation House we knew about, and like Rena Homes has been a really big group home that has had many outbreaks across the province, but it's hard for us to tell the significance of those rates of spread within single organizations if we don't have access to that data, because group homes includes forensic psychiatric group homes, children's group homes for people using drugs, group homes for people with intellectual and developmental disabilities, and the list is extensive, so I'm not going to go into it, but that's just demonstrates how challenging it is to look at the data and understand how we failed and how this impacted disabled people so that we can make better health decisions.
So we don't have data on how they did in terms of outbreaks. No data. Not any other public health unit.
So other public health units have noted group home and domiciliary hospital outbreaks, treating them like long-term care and retirement homes. So you can look at Newmarket, they've published theirs in a way. Also, the York Health Unit has done a really good job of reporting group home and domiciliary hospital outbreaks. You can just search the name of the home and it'll tell you if there's been an outbreak. We don't have that, and we don't have, similarly, other health units do the same thing with public health inspections because it's in the health and safety of our community to know what's going on within these spaces, but we don't do that here. So the Niagara region does a really good job of publishing their public inspections.
Thank you.
Thank you very much, and thank you to the delegation. Our next delegate tonight is Alex Silas. Alex is with the Public Service Alliance of Canada. Good evening, Alex, and you have 5 minutes.
Good evening. Thank you, councillors, conseillers, conseillères, board members, chair. Thank you for having me. Thank you for the time. My name is Alex Silas. I'm the Regional Executive Vice President for the Public Service Alliance of Canada, National Capital Region. Je m'appelle Alex Silas. Je suis le vice-président exécutif régional pour l'Alliance de la fonction publique du Canada, ici dans la région de la capitale nationale. I'm here to join the call of Horizon Ottawa and other speakers we've heard from to call for healthy and safe workplaces for workers at Amazon. I'm here as a union rep and as a member of the labor movement to show solidarity with these workers, because all workers in Canada, whether unionized or not, deserve safe workplaces. There's 3 main rights that all workers have across the country, regardless of what province or jurisdiction you're under. You have the right to know, the right to participate, and the right to refuse. Those are rights under the Occupational Health and Safety Act. You have the right to know about health and safety matters, the right to participate in decisions that could affect your health and safety, and the right to refuse work that could affect their health and safety and that of others, the right to refuse unsafe work. The right to know means that as workers, you have the right to be informed by the employer of known or likely hazards in the workplace. and to be provided with the information, instructions, education, training, and supervision needed to protect your health and safety. This information should be provided before the work begins. Workers should have the right to know if their workplace safety has been compromised, especially during a pandemic like the COVID-19 pandemic. The Ottawa Public Health Board has a responsibility to help this happen, to make sure that those workers are informed. So we're asking you to intervene in situations like this to prevent workers from being from suffering from unsafe working conditions and not being informed of their rights. We're asking that the OPH intervene so that workers are properly informed when outbreaks occurs, that the public is made aware so that the public can also make informed judgments, and that actions of employers are carefully monitored to ensure compliance with public health orders. Employers like Amazon, especially these mega corporations that have a notorious reputation of mistreating their workers. The Ottawa Public Health Board has the authority to demand and ensure safe working conditions for essential and at-risk workers, like the workers in the Amazon facility. There are already so many voices speaking up for the economic interests of businesses in this time, but we need more voices speaking for workers. But we need your voice as OPH members to ring out loudly, clearly, and powerfully in support of workers in Ottawa and their families and our communities. I'm concerned that there's a lack of transparency about the role of workplaces in community outbreaks. I've heard that publishing businesses, information about businesses would affect or would violate privacy, contribute to stigma. But when it comes to big businesses, big corporations like Amazon, what essentially this means is it provides cover for these major corporations from being held accountability. And it allows them to become unaccountable and to mistreat their workers and keep them in unsafe environments. So what this results in is mega corporations like Amazon being prioritized over workers, over members of the Ottawa community. I also feel that combining this data, or aggregating the data between private gatherings, apartment outbreaks, and workplace outbreaks, this also obscures the picture. On s'entend que we can agree that there's a difference in terms of the impact of an outbreak in a facility the scale of the Amazon facility compared to a barbecue. I think we can also agree that the accountability is different when it comes to a corporation like Amazon versus a small gathering. So businesses need to be held accountable for their working conditions and be transparent with the community. And I'm calling on the OPH to enforce that. Just in this case that we're talking about at the Amazon facility, for this to be brought to light by Horizon Ottawa, a worker had to come forward anonymously because they feared for their employment. I'm hearing from some previous speakers that, most of the data that we have is just from news stories covering Amazon. And these are all cases that are coming forward from employees that are coming forward anonymously. I would think and I would hope that the OPH could be more proactive in identifying these cases, identifying these unsafe working conditions, instead of relying on workers who fear for their jobs coming forward anonymously. Now, as was mentioned by previous speakers, we've seen similar situations in Toronto and Peel, where the health units there have intervened to shut down operations.
Alex, I'm going to have to ask you to wrap up. You're over your 5 minutes. Okay, well, the gist of it is I'm hoping that the OPH can intervene and that we can protect these workers. I'm asking that public health step in to ensure that the Amazon facility is a safe workplace for the workers there. Thank you. Thanks very much. I don't see any hands up for questions, so we'll move to our next delegate, which is Pravina Diaz.
Hello, my name is Pravina, and I'm a community member living on unceded Algonquin territory here in so-called Ottawa. I am frustrated with OPH for not supporting essential workers during the COVID-19 pandemic by avoiding publicly holding companies accountable. Employers' accounts of workplace safety protocols and their implementation alone cannot be trusted when they are more concerned about their productivity and profits than the health and safety of their employees. There's no either or when people's lives are at risk. The minimum we can do is prioritize worker safety, and that starts with addressing pressing issues. Paid sick leave, transparent reporting, treating testimony from workers seriously, and enforcing employers to take appropriate action to prevent and respond to outbreaks. We cannot trust these companies to take care of workers when they have contributed to 149 known workplace outbreaks, 934 cases, and at least 6 deaths from COVID-19 in Ottawa. And these are only the numbers that are known because OPH refuses to transparently report these outbreaks publicly. According to CBC, Amazon sent a dozen text alerts to Ottawa warehouse employees in January alone to notify them of COVID-19 cases at work, but were not required to close. It seems like common sense public health policy to collect and provide data to the public, but OPH has insisted on continuing to protect companies whose workers have expressed concerns about systemically lax adherence to COVID-19 rules and positive cases. In terms of workers' rights, Amazon, who has seen at least 35 cases in Ottawa, according to reports, is known for pressuring its driver associates to meet quotas to the point where they urinate in bottles to avoid having to take breaks. Amazon is more recently known for intimidating their employees out of forming unions. When it comes to their workers, companies like Amazon see dollars and cents where they should be seeing people. Workers in the United States have been quoted as saying the goal of Amazon is to get as much productivity out of us for as little compensation as possible. Another worker was reported as saying, "We're being treated like we are prisoners who are there to get a job done." An Amazon warehouse worker in Ottawa is quoted as saying, "The fear of getting COVID was very real. I was terrified of it, and I was terrified of giving it to my partner. Then we ended up getting COVID anyway." Other companies like Loblaw, who have seen multiple cases of COVID-19 in Ottawa alone, in stores like Shoppers, Superstores, and Loblaws, have not been compelled to be transparent about contact tracing with their employees, whether these cases raise to level of outbreaks. I've witnessed firsthand the fear of family members and friends who are essential workers that have no choice but to attend work and see these institutions they work for care more about their sales targets and quotas than whether they live or die. And I'm saying this literally. The city of Ottawa is known for this behavior from its relationship with developers who are known to actively cause homelessness in Ottawa and refuse to provide low-income families with safe housing, to the recent $2.9 million tax break for a Porsche dealership in Vanier. Several councillors on this board voted against the latter, whether due to community pressure or your own analysis. To me, this suggests that you have some understanding.
You're kind of getting off topic in terms of what you're responding to here.
This is on topic, sir, if you let me finish. So to me, this suggests you have some understanding that siding with businesses, and in this case, large multi-billion-dollar corporations, is not by default a public interest. I would suggest applying the same understanding to this issue. The leadership of these companies don't see their employees' health as being in their interests. Based on the wages they're paid, the pressure they're subject to, the lack of job security, they're seen as expendable and replaceable. I would hope the Board of Health does not agree with this assessment and listens to workers' testimonies about the environment that they're forced to work in, risking their health and that of their loved ones to make ends meet. It's of public interest to protect our community members, to keep them safe from COVID, to make sure that children don't lose their grandparents and parents, that elderly people don't lose their caretakers, that workers' rights, as we just heard about, to a safe work environment are respected. Immigrants, particularly people of color, are employed at warehouse jobs and other low-paying jobs that lack job security and safe work environments. This is an intersectional issue of labor rights, poverty, racism, sexism, and status, because women, Black and Indigenous, and other people of color, immigrants, people living in poverty, are disproportionately employed in these safe work environments. The healthcare professionals on this board should particularly be aware of this fact, and I've seen from what you've said that you are. As Horizon Ottawa has pointed out, putting the burden on marginalized and targeted people to advocate for themselves, to risk their jobs in order for their rights to be respected, this is abhorrent when their representatives, the municipal government, should be supporting them. It is the Ottawa Board of Health's responsibility to protect these workers, and the Ottawa City should not be interested in employers' profits over health. These workers have been risking their lives to try to keep themselves and their families housed and fed. For those of us who have the privilege of working from
Ms.
home,
Diaz, I'm
we
going to
can
have
do
to
so
ask you to
because
wrap up.
there are
You're
those
over
who do
your
not.
5
Yep,
minutes, please.
I'm almost done. So this privilege comes at the cost of workers like those in Amazon warehouses, Loblaw grocery stores, among others. We owe them more than we can ever repay. Regardless, we should be acting because it is the right thing to do to protect our community. I sincerely hope you agree.
Thank you. I don't see any hands up for questions. So we'll move to our last delegate on this particular agenda item, and that's Erin Surratt. Erin, are you still with us? There you are.
Yes, hi.
So you have 5 minutes, Erin. Thank you for coming out tonight.
Thanks. Good evening. Hello, members of the Board of Health. My name is Erin Surratt, and I'm a resident of the Somerset Ward. You may recognize me as this is now the third time that I've come to address you as the Board of Health in recent months. The first time was in February when I joined many others calling on you to advocate for paid sick days for all workers in the province. And I returned again in April to speak in favor of OPH prioritizing frontline and essential workers for vaccines. And today I am here once again calling on you as our municipal representatives to ensure that workplaces are safe for workers during this pandemic. So you may have noticed a trend. Each and every time I've come to this board, it's been to remind OPH and members of this board of the need to protect frontline workers, to show with your actions and not just your words that you really do value and care about these workers. So I'm going to repeat some of what's already been shared about the situation at the Amazon warehouse, but I hope that you will still listen. So over a year ago, a worker at the Amazon warehouse in our city spoke out publicly about how safety measures in their workplace were being ignored and their coworkers were getting sick and workers were not being informed. And now again, just a few weeks ago, another worker came forward and repeated the same concerns, describing how dozens of their coworkers, as well as themselves, had tested positive for COVID-19. They described the stress and the worry that they feel in this environment that they know, given that they and their coworkers have tested positive, is unsafe. The question I have for you, Dr. Etches and members of this board is, do you believe these workers? I'm not really sure why you wouldn't. It took incredible bravery for these people to speak out, given that these warehouse jobs are not unionized, they lack job security. Many of the people who work there are from immigrant and racialized communities who face discrimination and other barriers to employment. Dr. Etches, you spoke in your report about the importance of addressing systemic racism, and this is a clear example of that. The least we can do when precarious workers like these two Amazon workers tell us the ways their lives are being put at risk is to believe them. And if you believe them, then you are compelled in your roles to take action to stop the serious problems they have disclosed. Amazon is a giant multinational corporation and has been well documented in using its immense power and capital to prevent its employees from unionizing, which in Canada is fortunately a charter protected right. And as Pravina mentioned, it's been well documented that the working conditions in Amazon warehouses are horrific. This is the employer in question. So when an Amazon worker comes forward to say there are problems, the responsible thing to do as the public health agency is to investigate thoroughly. And the right thing to do is to be firm in enforcing compliance with public health orders. That should have been done a year ago when the first worker spoke out, and actions should have been taken to prevent further cases. But as demonstrated by the increase in cases at the warehouse and yet another worker speaking out, evidently this didn't occur. And the further responsible thing to do is to proactively ensure compliance by putting into place measures such as those we've seen in both Toronto and Peel regions to close businesses with outbreaks and to publicly disclose the names of all businesses that are closed. I know you are well aware of these initiatives, and I can't understand why you would not do the same for workers here in Ottawa. It is not trailblazing to bring in these initiatives at this point, but simply learning from the examples of other health authorities who've understood how critical it is to put in place strong enforcement measures rather than rely on the goodwill of employers to do the right thing. There is no goodwill of such sort in a corporation like Amazon. OPH ought to be there to protect those workers and not let Amazon or any other employer for that matter off the hook by allowing them to self-regulate. I'm urging you to believe these workers who have courageously stepped forward, risking their jobs and their incomes to blow the whistle on the unsafe working conditions at Amazon. Please take more action to address these violations, and please show the leadership of other public health authorities in the province by putting into place proactive measures to prevent further unsafe working conditions in our city. Thank you.
Thank you. Right on time. I do see a hand up, and I'll go to you, Member Menard. But once that's done, I want to thank Member Cloutier for pointing out that we've gone way past 7 o'clock without a motion to extend. So we'll have to deal with that after your questions, Member Menard.
Okay, thanks very much, Chair, and I'll be quick. Nice to see you, Aaron. Thanks very much for being here. I always enjoy your delegations, and just wanted to ask about the difference between ourselves and other public health units, and why some disclose and why we don't. And the reasons given for that, and I had mentioned one earlier today, but the basic reasons that have been set out by OPH is to protect the privacy of individuals who have tested positive for COVID-19 as remaining a top priority. And inappropriate disclosure, they say, can lead to damage to businesses, potential unemployment, and other harms to health, and can discourage businesses from disclosing outbreaks in a timely way due to concerns about risk of their business reputation. So I've asked this to another delegation because that is essentially what OPH is saying is one of the differences between ourselves and Toronto Public Health and Peel, for example. And it's interesting to get feedback on that and what your perspective and view is of that statement.
Sure. Well, I mean, I certainly don't have all the answers, and there are folks on this board who have a lot more experience in public health. So, my response is really just based on my understanding of employers' responsibilities in the workplace, and also the dynamic of the relationship that employers have with employees and that power differential. So, so I certainly don't have, the magic bullet, but I think the concerns you raised, I don't see them being any different than, in terms of context than they are in Toronto and Peel. And those health authorities did go ahead and publish the names of businesses where there were outbreaks. I have not seen any reporting that those businesses have gone out of business, have suffered losses, or that there have been unemployment as a result. So those kinds of concerns, I think about, there were similar concerns when there was talk of bringing in paid sick days, for example, that this was just going to cost employers too much, or raising the minimum wage for that example. It's going to cost employers too much. They're going to go out of business. There's going to be a loss of employment, when in fact, the evidence is not there for those consequences. So I would be cautious about coming to those conclusions without looking at the empirical evidence. And I certainly have not read of any sort of evidence of that kind of consequence. I also think there are, there's of course the carrot and the stick approach when it comes to employers, and generally in terms of the way that labor protections are approached in this province is to use the carrot and not the stick. There's an important role for consequences and holding employers accountable, not simply by having this kind of friendly relationship and hoping that they will disclose, but actually having consequences for not doing so. And there are many ways that can be done, through fines or through other types of negative consequences. And I think that's a really underutilized resource, certainly within this province. And even within our city. So I guess that would be my suggestion, is to look at those other ways that we can go about. I don't think it's enough to use those concerns to be a barrier to taking more action, because not taking action is going to result in continued unsafe working conditions, potentially more spread, even though we are hopefully, making our way out of this pandemic. We're not there yet. And it may not be the last pandemic. So hopefully we can put those measures in place so that going forward, workers are not exposed to COVID the way that they have been at this Amazon warehouse.
Okay, thank you so much, Erin. Appreciate that.
Thanks for the question.
Thank you very much. I don't see any more hands, so thank you to the delegation. I'm going to ask the vice chair to please bring the motion to extend time. I don't know, Deanne, do we have to somehow make this retroactive to 7 o'clock since we've gone over, or we just kind of all forget that part and just make the motion now?
Maybe just amend the motion to say continue to prolong the meeting past 7 o'clock. I apologize.
Sounds like an excellent suggestion. So if I can get the vice chair to introduce the motion, then please.
Sure. Be it resolved that the Board of Health approve that the meeting continue past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
And is that carried?
Okay.
Okay, thank you, everyone, and I apologize for letting the time slip like that. So we're going to move to questions to Dr. Etches and the team. I'd like to lead off on that quickly, just with sort of a general question. Dr. Etches, we've heard a lot tonight from the delegations about differences between Ottawa's approach to workplace outbreaks and sharing information about them and taking steps against businesses, and those of Toronto and Peel. So I'm wondering if you and the team can speak to your understanding of how it works in Toronto and Peel versus how it works in Ottawa, and if they are in fact different, what the OPH team's rationale is for that difference, and why you think that's a preferred approach to be used in Ottawa. I know you prepared a written document that went out to board members last week, and all the members would have received that. But for the benefit of those listening in to the meeting and to respond to some of the questions we've heard tonight, if you could sort of use that as a jumping off point and again explain what your understanding of the approach is in those other jurisdictions, and if it is different from what we do, why you think our approach is the appropriate approach for a city the size of Ottawa.
Thank you, and I want to also thank everyone who came out to speak tonight, because it is always helpful for me to understand concerns in the community. I think there's a number of things I would like to touch on, but I think it makes sense to start by indicating that our interest absolutely is to protect workers from COVID transmission in the workplace, and that the way we approach our work is with that goal in mind. There was some conversation about it's either the business's health or the worker's health, and that dichotomy, is not one that we're choosing. It's about protecting workers from COVID transmission, from outbreaks in workplaces, And we know that it's also useful to keep businesses running so that people have employment and that protects their health. So, the way we work with businesses is to ensure that they can continue to operate and employ people. So what we know has happened just in this pandemic and just in the peak of the increase in COVID in January and then in April, is that there were some different practices implemented in Toronto and Peel that really deviated from the usual public health approach, which is that we will inform the public when there is an outbreak in a workplace when that's needed to decrease the risk to people. And so our typical practice, and those of all of our health unit partners, is that we would do the investigation when somebody tests positive, make sure we work with them to identify all their close contacts, including in the workplace, and then notify each of those close contacts and work with the workplace to make sure that workers are notified, and we do that work also. And then to look for those links in the workplace to ascertain whether that is there, and if it is, according to the definition, the most likely source, we would declare outbreaks. And we have provided more information than usual about outbreaks on our website, and I take the feedback that it's maybe not easy for people to find where that is. So, I think we need to look at where that is placed. I think we can look at doing things like making the totals easier, making it easier for people to find out where they can get details about individual outbreaks. What Peel and Toronto did was, at the time of the lockdown, Peel decided that it was important at that point to have a Section 22 order to close businesses where there could be and identifies a risk to the public, or collaboration is required for more contact tracing. It's in order to properly implement protective measures and identify if there are people who haven't been notified. And at that point and today, throughout the pandemic, Ottawa was able to continue all of our investigation and all of our follow-up so that we didn't lose the ability to carry out those full investigations as they were experiencing in Peel. And that they have decided that these kinds of closures were really just warranted during the lockdown period. In Toronto, there continues to be, since this time when, the context was that there was a sense that more workplaces should be closed at that point to control the pandemic. Since that time, they've continued to report on outbreaks in workplaces that have 20 or more employees. And so we see that continuing. They don't actually keep a record on their website of what's happened, but when there's an active outbreak, that's there. For us, what that would mean, is that in Ottawa, the most likely businesses that would be named would be restaurants. And clearly there is a risk that restaurants in a competitive environment who have already struggled this far would just have people go to their competitor when there's no ongoing risk to the public, just because they've had an outbreak where we've implemented the appropriate control measures. So there's no need for a public health reason to disclose, and there is potential harm to the business and the workers in ongoing employment. So we have seen this with foodborne outbreaks. There have been times when it's become public that there's been a foodborne outbreak in a restaurant and it has gone under. So it is a real risk. I think the other thing that I noticed in the conversation was that Amazon and working conditions were mentioned a lot. And I know the board cares about working conditions. That's why we advocated, you directed us to advocate about sick leave. I think there are other levels of government and the Ministry of Labor that need to be involved when there are complaints about working conditions. And I I knew there was a lot of interest in Amazon, so I actually asked Amazon for permission to describe what we have done with them over the course of this pandemic. And so I'll just make sure I have the information to reference. So this is disclosed with consent. That in October of 2020, there were people who worked at Amazon who tested positive, and Ottawa Public Health got those reports. There were 9 staff involved, and we did on-site investigations as well as follow up with everyone who tested positive. And it was determined that it was not an epi-link that was well defined in the workplace, that there were other practices where people came into contact with people who were testing positive that remained a likely source. At that time, we did an inspection of the practices in the facility, and their procedures did appear to be appropriate. We also had good cooperation with Amazon to carry out these investigations. The second time we investigated at Amazon was in January of 2021, and there was a confirmed outbreak. At this point, we identified 5 staff who tested positive that were linked to transmission in the workplace. And so again, we review all the infection prevention and control practices. We work with them to review, and it appeared at that time that they did understand how to reduce transmission in the workplace. So since then, when we received a complaint about practices, we went back just this month to review infection prevention and control practices. And again, it appeared that they understand what's needed for COVID control. So if there are ongoing concerns about a workplace, I do know, we'll continue to respond, and the Ministry of Labor, again, is appropriate for addressing working condition concerns. So I think the situation in Peel and Toronto is different in terms of the size of the workplace outbreaks that have happened. And I know that there's interest in learning as much as we can about workplace outbreaks. So I wanted to go back to touch on the idea of trying to learn more about specific types of workplaces. So group homes, for instance, I think this is something the staff can take back to see what we can learn from our data to provide more feedback on policies that could affect institutions. And I think that I would maybe might not have covered everything, but probably if there are other board questions, that will cover it.
No, I think that was very helpful, Dr. Etches, a good recap of what you sent out earlier to all the board members, so that they would be prepared for this meeting, and did respond to questions we heard tonight, and again also, in a very public way, shared the information, and I also want to thank you for reaching out to Amazon to get permission to discuss what actions in fact have been taken by public health with regard to that situation. So that's good and helpful information for us. So I'll go through the list now of members in order as provided by the board secretary for questions. And so the first member is Member Tilley, if he has any questions tonight.
Just a general comment. Of all the board members, I think I'm with one of the few organizations that's been on the receiving end of the Ottawa Public Health work, having to come into our workplace and work with us to ensure that proper protocols and processes are in place. I can assure all those people who presented and spoke today to the board of Ottawa Public Health, it's thorough at all times. Certainly it's hard medicine for us sometimes, that our processes that we now have to follow, that 2 positives and we're back in outbreak status, and how that can limit our ability to carry on with what we do. But at all times, the public is safe. And I'm glad to hear of the way you worked with Amazon, Dr. Etches, that in fact you weren't bowing and scraping to economic interests. And I think there's been some confusion. I hear the angst in people about some of Amazon's purported work practices, whether those are valid or not. But I think there's some confusion there with some of the way people feel about maybe a big business or a big capital business such as that versus our role to play in dealing with them when there's an outbreak. And the two have to be separate. Whatever their labor practices are in that versus our ability to step into a workplace and address outbreaks when they occur in those workplaces and balancing everything that's in the best interest of all parties. So I think you've done a remarkable job. I know your team has done a remarkable job when having to come and deal with us at the mission when we've been in outbreak status and ensuring that all factors are considered in enabling us to carry on with our operations while recognizing the concern that we are in outbreak status. So I think there's some, again, as I said, confusion about just the big business sector versus Ottawa Public Health's response to dealing with workplace situations like that. So hats off to you and your team when you do deal with those things, because as a group that's been on the receiving end a couple of times, it's thorough, it's protective, yet it also balances our need to carry on and do the work we do. So that's the only comment I really have to answer. I think you answered any other questions I would have had.
Thank you, Member Tilley. And just for the benefit of the public, we on the board know what your organization is, but I don't think in your comment you pointed out who it is that you represent and the work that's been done. So perhaps you could do that.
Sure. So I'm the CEO here at the Ottawa Mission. We've had to work extremely closely at the very onset of the outbreak with Ottawa Public Health and Ottawa Inner City Health to ensure all practices, protocols, and safety measures were in place. And everything was working out fine with limited cases. We had a huge outbreak with positives here in late January. And again, a response working with Ottawa Public Health and the City of Ottawa to do what we could to ensure everyone was safe. And again, we've just recently, again, had an outbreak, 2 cases of clients, and right away, immediately isolated, put into isolation, immediately Ottawa Public Health working us to ensure anybody they had been in contact with, anybody who was a close contact with those individuals have been placed into safety. So far, so good. We followed all processes as per usual and are looking forward to when we move back out of outbreak status just because of those 2 cases. And again, transparency at all times, but also at all times our staff and the other clients we feel not at risk because of the work we're doing with Ottawa Public Health to immediately address any positive cases.
Thank you very much, Peter, for sort of putting your comments in context. Next member on the list is Member Cannell. If you have any questions tonight.
Thanks. Thanks for asking. I just a bit in the same spirit of that of Member Tilley. Thank you, Dr. Etches, for your presentation. Thanks for the response you gave us, well, part to some of the questions that the nice presenters who came this evening, thanks to them. And also thanks to you and your team for the ongoing work. And it's never ending. And you always have to think in the future what can be done. So thank you, merci.
Thank you very much. Next up is Member Menard.
Thanks very much, Chair. Yeah, I do have a number of questions, so looking forward to having some dialogue on this issue. Appreciate the Medical Officers of Health overall report and the work that's been done. I do want to talk about some of the data piece. And I'm wondering, because I just want to get clarity. We had analyzed some of this data early on that was publicly available, and we did it the onset of the pandemic into January of 2020. So is that right? No, March 2020 maybe to January 2021. And then I think the data was, correct me if I'm wrong, but was it taken off or no longer available publicly
No, there is still open data. So every outbreak has all the details related to the number of people testing positive, etc. That is still in the open data field, which is accessed through our dashboard. I can show you where that is, but it was part of the feedback was that maybe we need to make it easier to find.
And that's fair. We had found it at first. I think it was changed at some point, and then it is very helpful because it did show where workplaces versus saying open settings or other settings where transmission may be occurring. So that was very helpful to have that data there. It's not identifiable, but it was useful analysis for particular things like parks later on in the pandemic and keeping those open. So appreciate that. I do. So on the on around Amazon and where we find ourselves with that, and in comparison to sort of Toronto and Peel, and I did see the paper that was sent around as well to board members. So I think the thing people are trying to point out is that Toronto and Peel have some perhaps stronger criteria or more specific criteria, we'll put it that way, in place to determine when a disclosure and a potential closure may happen. And I just wonder is ours is fairly open and it's designed that way, I suppose. Is there other areas that staff might see that would be helpful to insert in that criteria to get clarity, or is this always going to be a sort of more subjective at first analysis and using objectivity when you get into that business? So are there other things you could add to that?
So I think the criteria actually is similar now between between Peel and Ottawa now that their lockdown measures are ended. So it really is that we will disclose the name of a business when we need to be able to find people who could be at risk. And we have done that. And we've also used progressive enforcement to issue an order against one business in the course of this pandemic where they weren't providing us with information. So we do have a stick. We will use it. I think what you're asking for is clarity, to name that, to label that in terms of when we would use those kinds of enforcement tools. So we could certainly provide more information, to explain explicitly. It's when an investigation identifies that there's ongoing risk or we're not getting the collaboration that we need to be able to fully investigate and eliminate that risk.
Okay, that's helpful. And I know there's been several instances of, there's been some instances where there's several dozen cases associated with a single outbreak in some of the more recent data on community outbreaks. But do we know what the largest number of cases we've seen in relation to a single workplace outbreak is?
I don't have that number on hand, but I did ask the team to look at out of the, I think we've had 150 confirmed workplace outbreaks. Only 13 had more than 10 people who tested positive. So we really are looking at, in Ottawa, again, our experience is workplaces have been cooperating very much and working with us. And, out of 150, it's only 13 where we see more than 10 people testing positive. So I don't have the maximum number, but I could get that for you.
That's helpful. And for those 13 where we had more than 10, what is the protocol with those businesses? What does it look like? Are they automatically shut down and there's investigation with employees there and notification automatically publicly? What happens at that time when there's been a large amount of transmission?
I might actually invite Dominic Bremner, who's our manager of the infection prevention and control team, just to hear from her directly as she does this work with her team in terms of how you proceed through those kinds of situations. Dominic, is that okay if you want to describe what happens? Or is it Sherry who's here? Sorry.
That's okay. I just see that Dominic did have to drop off. So So the question again, Member Menard, is with respect to how we go about, I'm just paraphrasing here to make sure I have it, how we go about our investigation and disclosing of workplace outbreaks with greater than 10 individuals. Would that be fact?
Yeah, where there's
How do we manage it, and what would lead us to decide if there needed to be disclosure? Yeah.
So, I mean, I think Dr. Etches did cover some in her answer with respect to the level of cooperation and the timeliness of collaboration. That is key with respect to our investigations ongoing in workplaces where we have demonstrated workplace transmission. What I would like to also share is, the risk of ongoing transmission in the workplace, whether worker to worker or worker to patrons, is also something that we gather information on and investigate whether there is infection prevention and control ongoing lapses, or whether they are in fact meeting the requirements as set out by the public health unit. So there's a number of key assessments that are conducted where we do risk assess on a case-by-case basis. And if we are not confident in terms of the information that's collected on the transmission and it being ongoing, then we would not hesitate to either take action such as closure and or reach out to the public via a public service announcement or otherwise to better understand the reach. I can assure that in almost all cases of our workplace investigations, that the cooperation, collaboration has been such that we were confident that mitigation measures were in place and that spread and IPAC measures had been adopted where compliance was sought. And we did not need to use a progressive measure to move forward on those investigations. So generally, that's how we treat the investigation of these outbreaks. It's no different whether there are 4 people, 10 people or more, whether it's a small or large facility, no matter what the sector, the outbreak measures are the same for our investigations. Thanks.
And I did get that maximum number for you also, Councillor or Member Menard. It's in an office setting. There were 54 people once tested positive in an outbreak related to an office.
Okay, and the same protocol that was just described, which is very helpful. Thanks so much, Ms. Beadle. That same protocol would take place then. Was that office disclosed and named at that time, or was it just that after going through the investigation, it was determined that their health protocols were improved as a result of the investigation and there wasn't a risk at that time?
So in line with how we treat all workplaces, Member Menard, we were satisfied that the measures were in place to mitigate any risk, and disclosure per se occurred as per our regular practice that you see today.
Okay, and I can appreciate some of the concern around business reputation, but I think there's a risk to reputation based on some criteria, right? If we don't have those in place and it's not understood by the public as it appears to be now, the current campaign that we're seeing around Amazon warehouse suggests that perhaps lack of clarity can itself be a source of community pushback. And it's worth noting that companies as large as Amazon probably don't see Ottawa Public Health or our own intervention disclosure as a significant risk. And so I put that out there in terms of that business reputation piece. I guess I also appreciate we don't want businesses to breach public health rules in response to potential disclosure and closure. And I appreciate reading that in the letter on Friday. But I'm unaware of that being the case in other jurisdictions where there are more specific criteria for closure. Do we have evidence that is the case, that we're seeing that happen in Peel and or we had in Peel and in Toronto?
In fact, the criteria for closure in Toronto and Peel are still founded on public health risk assessment. So in Peel, there are no longer provisions to automatically close a workplace when you have 5 or more cases. That's done. That was for a particular time and place. In Toronto, I believe that still is in place, the option. So it says that there could be, Toronto Public Health may, in its judgment, require that there's a full workplace closure, but it is still based on a public health risk assessment, and it isn't a routine automatic action. So I think you can see that this is about what's needed for public health purposes. And so I hear what you're saying, that we need to make that clearer to the public. And I think we can look at how we present all of our workplace related information so that people understand that this is how Ottawa Public Health is working to make sure workplaces do protect workers and patrons.
I appreciate that, and let's hope that we don't have to use any of those protocols in the near future. We're heading in the right direction now, and I think obviously we're looking backwards a little bit, but of course there's always a risk in the future with where we are, and so I'm hopeful that it's not having to be used. But I appreciate the answers and the delegations tonight. So thank you, Chair.
Thank you. Next is Member Lakin.
Thanks, Chair. Thanks, Dr. Etches, for the report. I want to shift from the past to the future, if I could, and first begin with an expression of deep gratitude for the comments you made in your report, Dr. Etches, about continuing to pay attention to mental health while we're going through this unprecedented crisis. It didn't escape me that in your remarks, in spite of the efforts of OPH to effectively save lives, it hasn't stopped OPH from continuing to focus on those determinants that will impact the 4th wave, which is the mental health of our community. So just a huge thank you for continuing to focus on that in spite of every other distraction. The question I had to do with what, if any, role public health units and OPH in particular might have with respect to the staged reopening of businesses, and in particular, a conversation around whether green passes or vaccine passports will be part of local thinking with large public events that when they're mandated by the province to reopen, whether OPH might have a conversation with city partners on that. I'll just preface my question by saying it wasn't lost on anybody watching the playoffs, the difference between what the Forum in Montreal looks like and what the arena looks like in Las Vegas. I don't think anyone on this board would go to a game in Las Vegas simply because of common sense. So with that in mind, will public health units have any conversation with the city and or large public event holders around the idea of using a vaccine passport or anything like that as we get ready for the next stage of reopening?
Thank you for the question. We do know that, sorry, there's an echo. We do know that the federal government is, it would be involved in what is required in terms of vaccination status for certain activities that cross international borders. And we've started to see today, or just this week, I think, a recognition that people with 2 doses of a COVID-19 vaccine can adjust what's required in terms of the quarantine measures upon return. So there is required proof of vaccination. So people need their receipt. That's not exactly a vaccine passport. I'm not sure if the federal government will have anything further on that. And then when it comes to what's required for events in Ontario, that really will be provincially driven. So right now, all of the stages of reopening are provincially set. What can happen in terms of the size of the group, the event, that kind of thing. And I expect that will extend to what can vaccinated or non-vaccinated or partially vaccinated people participate in a way that is lower risk. So I don't foresee myself in Ottawa Public Health really implementing a vaccine passport kind of approach that would be Ottawa specific. Sorry, I can't hear you there.
Yes, sorry, I realize that. Sorry. Thanks. I'll leave it there. I just wanted to hear what the current thinking on it was, and appreciate it very much. Thank you, Chair. Thanks, Dr. Edges.
Thank you, Member Lycan. Member Kavanaugh, please.
Thank you very much, Chair. And thank you, Dr. Etches, for your report. I'm very encouraged by how we're moving forward. Fantastic work on the vaccinations, by the way, and the clinics. The pop-up clinics are going very, very well. And I want to thank all your staff for all the work they did this weekend, for example. It's very, very positive. Very encouraged by what you're talking about going forward in terms of for the, only we're going to talk about that more later, but in terms of overdoses and the work we need to do. It's definitely an outcome of COVID as well. It's kind of the, well, I think we're seeing the numbers now. It's a bit of an iceberg, but we're seeing how much is out there as we slowly recover from COVID. I just wanted to get an idea of how we're going to move forward on that, because I know that that's something that is kind of a next step. We have to catch our breath, and we are moving forward. But are we working with our partners in the community on next steps?
Yes, so I mean, our team has tried not to pause in the harm reduction work and in supporting people with problematic substance use, but we haven't been able to make the progress, with partners that's needed, obviously, to have prevented the increased deaths. So I am seeing a lot of commitment by health care partners and leaders that determine priorities for the healthcare system to focus on mental health and substance use, specifically because of the recognition of what's happening with the overdose numbers and people dying. So I think that I feel very hopeful that the partners we've been working with and others who can inform more conversation, such as, where there are further ideas to advance around decriminalization, that we can come forward with recommendations from the community to put before you in terms of what is Ottawa Public Health, addition to advancing system work to really improve things. And I guess what I would say is we really, really know that it isn't possible to address the opioid crisis with one intervention. We need support for people to access mental health and substance use. And there's been progress in the portal and the doorway to get there, but the appropriate services, the evidence-based services, the services integrated with social services and housing, there is just so much more to do. And so this is the kind of conversation we expect to keep having with city partners as well. Community social services, emergency protective services, police, right? The idea that we need other pathways than the criminal justice system for people who are using substances is very clear. And the chief of police in Ottawa agrees with that. And so it's about bringing these different partners together so that we can establish those different pathways. So when police are involved, where can they refer people, there has to be a service there that can accept someone. So, Ottawa Public Health doesn't provide those services, but we point to the need and we rally with partners to see what we can do here in Ottawa that's tailored to the needs here. And we need to hear from people who are affected about what will be most appropriate. So these are the different perspectives we need to bring forward. And we can't leave the broader community behind. When we're talking about changes to drug policy, we need to build understanding of what it means. What is it? I mean, there are perceptions that are created when we talk about decriminalization, but it's actually I think a policy that most people, when they understand it more, would appreciate. It's about treating people who have a health condition, humanely and not doing more harm. So anyway, I think what we're aiming for September to bring you more of the consolidated picture in the community and get your thoughts at that point.
Great. I really appreciate that. I feel like that's an important next step. In terms of some of the information that was raised tonight in some of the delegations, I was curious about places like Edgewood and the other institutions that were not, where we don't have the numbers specified. Are we looking, maybe that's a Sherry question, but are we looking at showing that?
I think that is one area where I really do want to take that back to the team to think about how can we assist with understanding what's happening in residential, institutional residences. The problem with disclosure in this setting is that many of them are very small. The group homes often have 8 residents, and so we need to be careful. But I think in terms of informing policy, this is something that sounds worthwhile to be able to put some information, some recommendations together. And I think the speaker did point to some pieces that we could investigate in our data in terms of the number of people per room and the kinds of things that were learned in long-term care. I think that would be worthwhile.
Yeah, I think so too. Edgeworth has over 100 residents, and there are group homes, but they're often under one umbrella. So perhaps that, I don't know how that works, but it's still obviously very vulnerable people, the most vulnerable. And as well, the information that was raised about jails.
Yeah, I would also thank you for giving me the opportunity. I wanted to follow back on that. And so I definitely want to go beyond the letter that was sent to the Minister of the Solicitor General to pursue the idea put forward of working with community members, people with lived experience, to go into the Ottawa Carleton Detention Center, because I think this makes a lot of sense to provide information in an appropriate format. And I think the other context I would provide for the board is just that to go back to March, when vaccine was limited in quantity and we were having to prioritize other congregate settings. So we deliberately did the risk assessment, considering all of the different types of congregate settings, including the correctional center. It wasn't at the top of the list of the congregate settings that were prioritized. And this was done not just Ottawa Public Health, but we have a sequencing task force that assessed how, who's next in terms of going through how we can prioritize use of a limited supply of vaccine. Also, once we were working to get vaccine to the center, it was the Ministry of the Solicitor General that directed that we should start with a staff immunization. But we have been back multiple times. So I mentioned a couple of dates, but it's been more than one time that we've gone to offer immunization in the center, and now there is the ongoing capacity. So I think adding in more of the the appropriate spokesperson and source of information, I think would be an excellent idea, and I can raise that with the Minister of the Solicitor General. If she follows up on my letter I asked for a dialogue, so that I should have an opportunity to also promote that idea in conversation with the minister.
And of course, have the resources to do this extra work, because as you said, you had to make difficult decisions of what to do next because it was just so overwhelming. So we need more resources.
And I think the other thing that was mentioned is the homeless population is overly represented in correctional centers, and it is also a priority population for us. So we've been working with Inner City Health to immunize people who are homeless in Ottawa. And so I think that also contributes. We're trying to find people wherever they are, including people with risk of incarceration.
Okay, thank you. Just one last question. What constitutes an outbreak in a workplace? Because I'm getting different definitions, and maybe it's a very basic question.
Yep, so it has to be 2 or more people who have laboratory confirmed COVID-19 where there's an epidemiological link in the workplace and in a 14-day period. So they had to work, somewhere where there could have been an exposure between them. And that is also where it's reasonable that they acquired it in the workplace. And if there's a clear alternative source, like each person had somebody in their household who was also positive, that would be much more likely the source, because household spread is really much higher risk than a workplace environment where people have personal protective equipment or distancing or other measures in place. So that's part of the risk assessment.
Okay, I do have one more question. In terms of workplaces, are employees aware when these investigations are going on?
They may not be in terms of the whole employee workforce. I think that may be a decision made by the workplace in terms of how far they notify. But if they are an employee that's named as a high-risk contact and someone who needs follow-up to make sure that they isolate and they get tested and they know that they've been exposed, then those are the workers that need to be able to take action.
Okay, thank you.
Thank you, Member Kavanaugh, and Member Gower, please.
Thank you, Chair. Just a quick thank you to Dr. Riches and her team for the updates and advice today. And I think previous colleagues on the board have asked a lot of my questions, so I'll pass for any more. Thank you, Chair.
Thank you. Member El Shantiri, please.
Thank you, Mr. Chair. And I'd like to begin by thanking Member Tilley for his heartfelt experience with the public health. Really, when we hear someone put it in contact, it's just bringing it home. And also, I want to say thank you to Dr. Atchis and her team for myself as a counselor who represent the BIAs in the city of Ottawa, work closely with the small businesses. Your approach, your education approach, you're providing the toolkit, helping them to get ready for the opening and all. I just want you to know it didn't go unnoticed. So I just want to say heartfelt thank you to you and to the whole team. I know the team worked so hard to prepare us to the opening, and thank God that the opening went well, and we've been on for a while now, and it seems brought the city back to life, and also the education piece. And I have to speak about my own experience. And when I saw the public health speaking to a restaurant owner or bar owner on the education piece, they walk the beach in the heat, telling people, to stay the physical distance. All that, I just want you to know, it's not just about whether we handle Amazon properly or naming and shaming. I think sometimes more importantly is the educational piece, the one you can educate people and they take it home and they spread that education around. So I just want to say thank you. I don't have a question for you. I think my colleagues did a good job asking you all that question. I just want you to know, naming and shaming, it doesn't get us result. You're getting a good result because the people who work with you and for you, they're delivering a good service to the community. So with that, I just want to say thank you.
Thank you, sir. And Vice Chair, please.
Thank you, Chair. What a wide range of topics tonight. So it really, I was reflecting on clearly public health touches so many parts of our lives and the determinants of health. And, we are all thankfully passionate about that. And so thanks to the speakers as well. Just a few things to pick up on, and I do have a question. So I would like to build on what Member Tilley was saying about working in collaboration with OPH. As many will know, I'm my day job is with CHIO, and we have a team of infection prevention control specialists, but yet we partner with OPH when we have a potential outbreak as well. And I think it just speaks to the complexity and the expertise of OPH, that we really do count on them as the experts in giving us advice and frankly directives of what we need to do to make sure that we're following up. And so I do think that partnership and that open collaboration is important. If that's the role that they play with healthcare organizations, I'm sure that's well appreciated by businesses as well. I do think, the whole conversation around what we can learn from long-term care and apply that to other congregate care settings is an important one. So happy to hear that there's some follow-up there. And I know you, Dr. Etches, sort of grazed over it, but I was really happy to hear that the contact trace isolate is now firmly, we're able to keep up with that. And so, kudos to Ottawa for keeping our cases under control, that can happen. And again, want to be forward looking to, to fall, and just, if you could comment on what OPH is doing to make sure the team gets some downtime over the summer, frankly, but then is ready to make sure that we can maintain that, contact tracing and isolation where that's required as we head back to the fall. And, my mind, of course, goes to schools going back in and making sure that, that we can serve the our youth of this community and our kids and make sure that we keep them in school this year.
Yes, I can start, and it may be that Andrew Hendricks leads the school team and the case and contact management team. So if he would like to add, I would have welcomed that. I think what we see, it's very important to continue to keep COVID at the lowest rates we can to be able to manage more and more openings and so we've learned a lot about case and contact management in terms of how to best deploy different tools. So some people now can report into us and provide their information digitally, and some of these tools, actually serve the client better in terms of trying to reach them by phone or something. So I think that we'll continue to use a diversity of different methods to work to be able to understand where COVID is coming from and protect forward transmission. And Andrew, did you want to describe anything more specifically? We actually, maybe one thing, because it's the bigger picture. We are trying to ensure that employees take 2 weeks of vacation over the summer, in ideally 2 consecutive weeks, to have a real break. And therefore, we're trying not to shrink our teams prematurely as the COVID numbers come down. We want to be doing our full job, and we want people to be able to have backup when they're taking a break. So, I think that's why we speak to the fall being the time when we can stand up more of our other services, because we need to make it through this period of restoration. It is really serious how much the team has put their heart into this for a long time, and we do recognize the need to recover. Sorry, Andrew.
Yep, thank you, Vera. So I think the question was specific to schools, and I can say that we've been working very closely with the school boards throughout the whole school year, but that work doesn't stop over the summer months. And we continue to work with the school boards, and we will continue as we prepare for next year and next school year. So that actually starts in August, which isn't very, very far away. So the things we work on with them are things that kind of Vera talked about, but the testing, making sure that we have a plan for testing in neighborhoods and in the school settings. If we do identify cases, we have a full school year worth of experience to pull from and to draw on in terms of what works best in terms of getting people out into those testing environments. Immunization is very central to the whole strategy in terms of decreasing transmission. So teachers and educators have begun to get vaccinated, now for a couple of months, and we're starting to see people get second doses so that they can have 2 doses into our schools and our school educators before September comes along. And the other thing that I'd add into Vera's comment is, the need for public health resources broader than just COVID alone. So that is something that our conversation with our school boards we've been talking about. So it's the need for mental health and substance use. It's the need for, sexual health, all those other things that the school boards are interested in continuing to have those dialogues. We want to make sure that those are part of the September plans when schools reopen. So, and Vera's point about really the best strategy is to decrease community transmission. That is really how I think we as a community can best prepare for September reopening.
That's great. Thanks to you both, and for the whole team, of course, for all that you're doing. And I do hope everyone does get some downtime over the summer. No further questions.
Thank you, Vice Chair. And Member please.
Thank you, Chair. Appreciate the discussion this evening. I had no further questions other than what my colleagues have asked. Thank you.
Thank you. And finally, Member Banham, and I put your questions off about the Regional Detention Center. I think it may have been answered already. I'm not sure, but if it hasn't been, obviously feel free to raise it with Dr. Etches directly.
Wonderful. Thank you. I will echo the comments thanking the OPH staff for all their continued work. It is seen and felt, and I do think it's important to send lots of love and appreciation to the team, because it's been a really difficult year made with really difficult decisions. And I hope that people appreciate that. I think that if everything could be done and everything could be stopped, and there were no difficult decisions to be made of where to send resources or vaccines or staff, et cetera, I think you would be everywhere you could be. But that's not necessarily the world that we live in. So I want to thank you for doing that tough work and making those tough decisions. The prison question. So I just want to go back and kind of specifically ask a couple questions and wonder, while it's not your jurisdiction necessarily, from my understanding, is there a place to advocate for balance in the same way that you have done in the general population? Because, I'm only learning about this through today, so I don't have any evidence to say, yes, that is exactly true. But from what I heard, that 14-day quarantine piece, being subjected to that isolation, didn't necessarily make sense to me in a world where we have PCR testing readily available, and in the absence, I just don't understand the 14 days, I guess, in that circumstance, because if you could test even 3 days apart, why would you extend to 14 days? I don't know. And maybe this isn't the place to talk about that. And then the other piece is that 23 and a half hours in isolation with very little break outside. I just think that we have advocated over and over again that our public health measures need to be in place, but we also need to protect the other parts of somebody's well-being. And I think when we're looking at that extreme, we might have a role to play in advocating for some different measures to be used, at least in our city parameters. So I just want to give you an opportunity to respond to that, and otherwise, maybe we can talk about it another time.
Well, I agree with you that when someone is in confinement alone for 23 and a half hours, that can't be good for health. And so one of the ways we'd like to continue to work with the Ministry of Solgen is to try to promote more options for people to be isolated apart from that. And what it does require, I think, the people who spoke to us were experts in their field. I think they pointed to the need then for more space. That there are legitimate physical barriers to isolation that doesn't require that kind of confinement. So it is something, again, where we can learn from long-term care homes, but unfortunately in long-term care homes, we also had many people confined to their room, right? Like this is a hard downside that we've seen in this pandemic, and where we need to, really learn about how to engage people and find other ways to make that more humane. The 14-day period is important in case somebody's been exposed, or after somebody's been exposed, to make sure they're not incubating COVID, and then become infectious and then pass it on. And a negative test during that period doesn't rule out that somebody may be developing COVID. It's the same 14 days we use in every setting. So whether someone's exposed at work or at school, or that is the 14 days. And so again, it would be about what can be done to make that 14 days again as humane as possible. And it is a balance in terms of the risk to starting an outbreak. So I think this is something why we've made a recommendation to continue quarantine. We think it would make a difference in avoiding outbreaks. And you heard, once there's an outbreak, there's a big risk that everybody is then isolated. So, isolating one person for 14 days versus having to go into an outbreak and lock everybody down, we also have to weigh those situations.
Okay, thank you. So I want to talk a bit, and I feel like a broken record, and I feel very sad that it's always me bringing up the topic of parents. But parents and new parents are actually a huge part of what Ottawa Public Health used to do before the pandemic. And we heard a lot about mental health today, and we know through Canadian data that we're seeing new parents, specifically new parents who identify as mothers or as trans parents, would be even higher risk, that the case of depression and anxiety have gone up from 19% to over 35%, and that would increase with other social and cultural dimensions of health. And I bring it up over and over again, but I want to bring it up specifically in the context that we keep hearing that resources, and I mentioned this in my little intro comment, that we had to divert resources where they needed to be. But unfortunately, that has meant that the one place that used to be a place to actually screen new parents for depression and anxiety has had to almost abandon part of that role, unless it's for the highest of the high risk, which I know that work continues to do. And I know it's been a difficult decision to have to redeploy staff members. That is not a judgment. It does mean that when we're having conversations about mental health and those new parents aren't even mentioned, I think it further isolates them. And so I'm hoping that in our next update, we can hear a bit about the work that is being done with the highest of risk people who are new parents, and that we can maybe do some work to highlight mental health in that population, because while I know that all the other mental health work is also important, unless it's brought up, it doesn't seem like there's any focus or any attention. And unfortunately, public health was one of the last remaining places to address that need. So if we're not doing it, who is? And so I just wanted to bring that piece up. And I know I sound like a broken record and that I'm a one issue pony. I promise I'm not, but I do feel the need to
it's important. So in providing our mental health update and the strategy, we'll cover the lifespan. So from prenatal, postpartum, through to older adults. So we're looking at mental health across the lifespan. Every age group's been impacted in different ways. And I was trying to type and just see if there was a quick update I could give you today, because I know, in fact, this subject is under discussion in terms of more of a focus on postpartum depression, because there have been reports, and we see it in our own experience, that there does appear to be more challenge for parents right now. And so that is something we'll provide you with an update next time we meet.
I really appreciate it. And I guess the last thing is really just a comment about the fact that prior to the pandemic, there were proposed cuts coming down our way on public health. And I really just want to put it on record here that we are seeing what happens when public health doesn't have the resource it does. Things are naturally going to be redirected. And I just think it's important that we always remember that more investment in public health is needed to make sure that we can protect those who are the most vulnerable, because all of the jobs you do are so important. And when one thing happens, like an outbreak or like a pandemic, or it doesn't even have to be as big as a pandemic, then it really does strain the entire ecosystem of what public health touches. So I just want to continue to bring up so that we never have to fear again that those cuts are coming down in the future.
Well, I appreciate that, and we might need you to repeat that in some for future advocacy. We know there's catch-up work to be done to begin with, and then we want to learn from this about how not to go into the deficit in the future in terms of public health programming as much. And there have been some systems built that allow us to turn, for example, to a provincial workforce for some of the key case and contact management work. So I think this is something we'll be reflecting on as a whole sector, and we'll want to bring more to you around ideas for recovery and reimagining.
Thank you, all members, for their questions. Can we now vote to receive this report?
Received.
Thank you. We have one more item on the agenda, and that's number 3, Ottawa Public Health Strategic Plan for 2019 through 2022, update from Q1 of 2021. We do not have a presentation, but we do have one public delegation, Ms. Leila Attar. Thank you, and I apologize for the lateness, but there were quite a number of delegations for the earlier ones and a lot of good questions and discussions. So thank you for persevering and hanging in there. And I will turn the microphone over to you. Thanks very much.
Can you guys hear me? Yeah, okay, great. Okay, so good evening, everyone. My name is Leila Attar, and I'm a resident of Ottawa. I am here today to speak about the strategic update, and specifically to raise concerns about the discussion of substance use and the failure to name the overdose crisis. I urge the Board of Health to follow the footsteps of other cities that have signaled a willingness to work towards decriminalization, in addition to ensuring that data is kept up to date regarding the number of deaths in the city caused by toxic drug supply and inadequate resources for people who use drugs. I appreciate and acknowledge the work of Ottawa Public Health in the city around the COVID response. I understand that the pandemic has taken a serious amount of resources away from an already very full plate. This, however, does not suffice as justification for the absence of a cohesive overdose response plan that is led by people who use drugs. As we know, based on data published by the Ontario Drug Policy Research Network in May 2021, there have been a significant number of changes in the crisis since the onslaught of the pandemic. In short, things have gotten much, much worse. Concerning agenda item 3 on page 2 of the document indicates innovative responses to mental health and substance use are a primary focus for OPH. That is no doubt important. What I do not see, however, is any mention of the word overdose crisis or toxic drug supply, or the policy changes that are required to respond. I also see no mention of the fact that from 2019 to 2020, the city of Ottawa saw a 95% increase in overdose deaths. One would think these would be important to have written down and include. Under the second document of this item on page 5, I see a mention of a stigma delivery workshop to 55 elected officials and the power of language. That's great. What I'm wondering about is if it included a segment on the power of language in public health discourse. Now, I raise this because there are still resources that were emailed out last week, and even in the discourse that happened tonight, that focuses on problematic substance use. Surely in 2021, after a pandemic experience that has taught us all the importance of evidence-based policies in public health, we are not still proposing individual level solutions to a crisis wherein over 19,000 people have lost their lives since 2016. That, to be clear, that's 12 people across Canada daily. You know, I was happy to hear in the verbal report mention decriminalization. As people who use drugs and their allies have been saying for years now, this is a necessary part of the response to the crisis. This is because criminalization is a barrier to seeking healthcare, is the basis of stigma and social exclusion, and prevents the regulation of alternatives of known potency. Now, many critics are quick to say that decriminalization is not a silver bullet as a way of shutting down this conversation. So let me make myself very clear. We all recognize that decriminalization is not a final step to this crisis. It is but one of many tools that we have within our grasp as part of the response. It must be coupled with the expansion of harm reduction services, a transparent overdose response plan, in addition to widespread expansion of safe supply to meet needs across the city, and including rural areas. Now, at the last Board of Health meeting, at about 4 hours and 45 minutes, a member raised the topic of decriminalization. And in response, and this is not verbatim, another member responded something along the lines of, it wasn't seeming to be a priority because we don't see local police emphasizing that they will charge people. Now, what this response fails to recognize is that criminalization is actually more than a charge. It's a social process that defines a relationship that people who use drugs have with governments, healthcare and housing providers, and so much more. When we're faced with public health emergencies, we need to be very clear about the issues so we can actually get to work in addressing them. No more talk, no more empty words, no more vague bullet points in a strategic plan. What we need is action. Now, last week, Toronto's medical health officer submitted a report to the Board of Health whereby she recommended acting on the decriminalization of drugs at a local level. This is something that can be done under the Controlled Drugs and Substances Act under Section 56 exemption. Many other healthcare and human rights organizations have endorsed this in recent years. And currently in the Senate, Bill S-229 proposes decriminalization of all drugs. So my remaining question to you, the Board of Health, which is composed of people that are supposed to be passionate about community health and well-being, is if all these other organizations and bodies have recognized the overdose crisis and the need to decriminalize, why can't you? Lastly, and as one tangible item that is within reach, would be to keep information on the number of overdose deaths in the city as updated on the website as it becomes available. We need this to be easily accessible so that the public is kept informed, and this will inform our policy decisions. Like at this point, I don't know how else I can make you understand the severity of what we're dealing with right now in our communities. We need action, we need leadership, and we need it now. We have no idea what the federal political climate is going to look like in the fall. We can't pretend this reality does not exist. We can't make the mistake of thinking it will be secure, only for this to be pushed until late September, for the writ to drop, and then for exemption applications to be paused. This needs to be a priority over the summer. Like it simply cannot wait. So instead of sitting around and doing nothing now, and then joining us in our grief on Overdose Awareness Day, where you will repeat platitudes about the overdose crisis and how you wish you could do more, I am begging all of you to do more and to do it now. Thank you.
Thank you again for your patience in waiting this long to present, and I thank you for what you have provided to us. I think, and I'll ask Dr. Etches to elaborate after we've done questions, but we are very much engaged in a process right now with community partners, with people who have experience to put together a comprehensive report for the board that is being worked on as we speak, and that will be coming to the board. So just, you know, we are aware and we do appreciate what you've had to say and the input, and I think staff have even reached out to you directly for you to participate in that process, and I hope that you do, because you're a powerful voice. You're a voice of knowledge, and I do hope that we will be able to work with you going forward on this. So I'm going to turn over to Member Menard, who has his hand up for the first question.
Thanks very much, Chair. Thanks for being here. Sitar, nice to see you. I wonder, because you had mentioned it in your delegation around other jurisdictions taking action on their own and not waiting for a full federal strategy. And I know I'll take note of other jurisdictions in Canada that have done that. I wonder if you can elaborate on that, what that looks like, what that would mean for our city, and how that would help.
Yeah, absolutely. So currently underway in Vancouver, for example, is like the biggest headline right now. They've actually submitted a request to the federal government under the Controlled Drugs and Substances Act under Section 56, which is similar to like an SCS exemption or a supervised consumption application. And what that does is allows for decriminalization of simple possession of all drugs across the municipality. And so that, I mean, obviously what's happening in Vancouver is contentious, like there's issues with it. There's a lack of engagement, meaningful engagement of people who use drugs. Police are still considered legitimate stakeholders, which in itself is a problem. Like people who use drugs are the ultimate stakeholders in this, it's our lives. And so, yeah, beyond that, Toronto obviously has signaled that it seems like they'll be looking at submitting their own application in September, and other jurisdictions as well, like Montreal Public Health, Frontenac City Council, I believe, has also endorsed taking a municipal approach to an issue that has been neglected by provincial and federal governments otherwise. Yeah, and I would say that for Ottawa, something we should just be vigilant about is the ongoing lack of transparency and engagement more broadly of people who use drugs. Like it's great that there's a few organizations at the table right now, but we need like engagement with youth, with racialized people, with Black and Indigenous communities, people that have been criminalized. So we need to make sure that we're doing this in a way that like actually meets the needs of people in our community, and we're not just repeating the same things that we've been doing and having the same meetings with the same people. We need this to change. Yeah.
Thank you very much for imparting that knowledge for us. That's helpful. I appreciate you being here.
Member Menard, we're having trouble hearing you. I don't know if you're far away from your mic or.
Oh, I just was saying thank you.
Okay, appreciate that. Thank you. Member Kavanaugh.
Thank you very much, Chair. Thank you, Leila. I appreciate your voice on this, and you had a good op-ed piece a few weeks ago on this topic, and I appreciate it. As you know, I asked questions to Dr. Etches earlier on this. This is something I feel very strongly about, and I do believe that we are going to be working towards it, and I think we're going that direction. So I hope you will work with us, because I think it's a partnership, and that will be possible, because you make some good points, and it's something that's very big, and I hope we have the resources, because I think that's one of the difficulties too, is not just going at it. We have to make sure that we can do it properly in terms of having the right resources for it. I think you'd agree with that. But I'll let you comment if you wish.
Yeah, no, I absolutely agree. We obviously need structural change and policy change, but that needs to be accompanied by larger investments from the province and from the federal government, so that we can continue to expand what we know is evidence-based and what works, like supervised consumption, drug checking services we need in Ottawa, and it obviously safe supply, like widespread expansion of low barrier models of safe supply. Yeah.
Thank you very much.
I don't see any other questions for the delegate. I don't know, Dr. Etches, if you have anything to add before we close out the meeting on this particular matter. So, okay.
No, I mean, I think what Ms. Attar has pointed to are very useful inputs, and that need for appropriate engagement, is real. That's what we need to make sure happens, so that it's not Ottawa Public Health that's putting forward their ideas, but it is something that will make a difference to the lives of people who use substances.
Thank you for that. And as this matter was held, members of the board do have the opportunity to ask questions of staff, but again, I'd be mindful of the hour. We've all been thanking staff for all the hard work they put in, and this is part of it, being at the meeting till 9 o'clock at night. But they're here and we're here. If anybody has any questions of staff. Okay. Seeing none, we dealt with item number 4 previously, so I'm going to call on the vice chair.
Chair, we still need to receive this item?
I'm sorry. Yes, we do. And again, I was remiss. I want to thank Ms. Attar again for coming out and presenting. Very helpful comments, much appreciated. And yes, sorry, we need to receive this report. Received?
Received.
Thank you, Deanne. So I'll call on the vice chair for motion to adopt reports, please.
Be it resolved, the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health Strategic Plan for 2019 to 22, update from Q1 of 2021, and 2021 Operating and Capital Budget Q1 Board of Health for the City of Ottawa Health Unit Status Report be received and adopted.
Carried.
Carried.
Thank you. Do we have any motions requiring suspension of the rules of procedure? Okay, thank you. Are there any notice of motion for consideration at a subsequent meeting? Okay. Could we have the motion read the confirmation bylaw, please, Vice Chair?
Be it resolved, the confirmation bylaw number 2021-3, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of June 21st, 2021 be read and passed.
Carried.
Carried.
So I want to, sorry, before I go there, are there any inquiries? Okay, seeing none. Before we adjourn, I just want to thank everybody. This is our last meeting before the break. And I want to thank everybody. It's been another long meeting, but it's been a good meeting, I think. Lots of good discussion, lots of good questions. So I appreciate your assistance. And I want to thank staff as well for being with us tonight. And Dr. Etches did mention the importance of everybody getting time off this summer, hopefully 2 weeks in a row. And I can say as the board chair, and I think probably everybody sitting around this table or this virtual table endorses that approach as well. Please take some time, please recharge, take this opportunity to be with your families, have a bit of a break. And we thank you so much for the work that you've done over more than the past year for everybody in the city. It's so appreciated. And but you need to take care of yourselves as well. So you need to take that break. So please do. Adjourned. Okay, I have to read this out quickly. The next meeting is September the 20th. Before we close, just want to remind any media who may be watching this meeting on the YouTube live stream that we will have a Zoom media availability 15 minutes after adjournment. This replaces the post-media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. Thank you all and have a great summer.
Have a great summer, everyone.
Thanks,
Good evening, bonsoir. Thank you for joining us for this evening's media availability. This availability is meant to replace our usual media scrum after Board of Health meetings. Ce point de presse vise à remplacer la mêlée qui aurait normalement lieu après les réunions du Conseil de Santé. Before we begin, a few reminders. Please place your microphone on mute until I invite you to ask your question. Veuillez désactiver votre microphone jusqu'au moment de poser votre question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Ici ce soir, nous, pour vous, on the call this evening, Board of Health Chair, Councillor Keith Aglai, Président du Conseil de Santé, le conseiller Keith Aglai, Dr. Vera Etches, Medical Officer of Health, Médecin Chef en Santé publique, Cameron Keys, Director, OPH Knowledge Exchange, Planning and Quality, Directeur d'échange des connaissances, planification et qualité à CPO, Svetlana Valkova, Manager OPH Performance and Corporate Services, Gestionnaire Rendement et Services Organisation. On commence tout de suite avec votre question. We'll get right into questions. Each agency will get one question and one follow-up. We will go in reverse alphabetical order, starting with CBC Ottawa, Nicole Williams.
Hi there. Hope you can hear me okay. My question is for Dr. Etches. I just wanted to touch base because I don't think it was shared with the media about this letter you sent to government about the detention center. I'm wondering if you could just go into a bit more detail about what was involved in the letter.
Yes, so the team reflected on our experience with a large outbreak in the Ottawa Carleton Detention Center and our experience also with learning from long-term care home outbreaks to inform 3 recommendations to discuss with the ministry. The first was to move ahead with expanding what's being implemented right now as a pilot of using rapid testing before people are transferred into centers, correctional centers, and to really look at expanding that as a good practice more broadly. The other was to ensure that practices support creating greater isolation capacity within centers so that if someone is transferred in from another area, that they are able to do the 14-day isolation period that would be required. And the last was to find ways and processes to track immunization coverage among people who are in the center as well as staff so that we could monitor progress in the coverage rates.
Thank you. And my second question actually has to do with the mixing and matching of doses. I know Ottawa Public Health and many other health units are sort of dealing with, I guess, nervous people about mixing Pfizer and Moderna because Moderna is going to be the only vaccine available for the next few days. Are you anticipating a number of maybe canceled appointments, walkouts? I know, like I said, the messaging has been pushed, but we're still hearing from people that it doesn't matter. So I'm wondering if you are anticipating any canceled appointments if Moderna is the only vaccine available, and if so, if there's sort of a contingency plan there.
Yes, I would like to speak to people who are eligible for a second dose and who are, perhaps they had Pfizer as their first dose and they're looking at Moderna for their second dose to really encourage people to know that both RNA vaccines, mRNA vaccines, are essentially equivalent in terms of the science behind them, the studies that have been done, the effectiveness, the side effects, the profiles, and so it really is acceptable and the best choice to complete your vaccine service excuse me, I'm tired, I think, complete your vaccine series as soon as you can. And with the available vaccine, you know, that booster shot, that second shot is really important given the variants of concern we know are you know, going to be best stopped by someone who is fully vaccinated with 2 doses. That will protect you against onward transmission. And so, you know, I think we aren't sure of the ongoing supply of Pfizer or Moderna. The supplies that come are confirmed often just a couple of weeks ahead, and so we don't want people to wait. Don't wait to get that protection that really is so important as we want to get everyone fully vaccinated and be able to proceed to more of the reopening process.
Do you think, though, that the hesitation may translate in people saying, you know what, I'll wait? You know, we've spoken to a few people that have heard the public health advice, that know what the recommendations are, and it sort of seems to not matter to them.
Well, I would encourage people to step back and take a look at the broad context, which is that these vaccines are safe and effective, that are approved, and they're needed at this time, you know, to be able to return to the kinds of services and supports that are important for our population and get people back to work, get children back to school. So I think that I would encourage people not to take a chance on what might be coming in terms of vaccines in the future, but to really use the opportunity to book and have your vaccine now. There are many people who are waiting for those second dose appointments, and you know, we need to continue to make sure that the whole population has that opportunity. And so the vaccine that's available will be an mRNA vaccine in our clinics, and we'll make sure people have their questions answered. You know, the professional that immunizes will be able to answer questions on the spot, as well as I always encourage people to check our website for information about the vaccines.
Thank you, Nicole. On passe maintenant la parole à le droit, Annie-Rose Deschâtelet.
Oui, bonjour, est-ce que vous m'entendez bien?
Oui.
Parfait. Bonsoir, Dr. Etches. J'ai seulement une question. En fait, vous avez parlé ce soir là, pendant la réunion que vous étiez encouragé de l'avancement de la vaccination. Vous aviez espoir que les écoles puissent accueillir de nouveau des élèves cet automne. Mais on entend de plus en plus parler d'une possible 4e vague justement cet automne. Est-ce que vous la craignez, cette 4e vague-là? Et comment est-ce qu'on se prépare là, à Santé publique Ottawa pour y faire face dans la région?
C'est toujours possible d'avoir une augmentation dans le niveau de COVID-19 dans la communauté parce que c'est un virus vraiment transmissible et avec les variants d'intérêt et de concern, il y a plus de transmission et il y a des gens qui n'ont pas immunité. Alors, la priorité, c'est de vacciner la population, de créer la protection contre la transmission de COVID-19 avec les vaccins, les 2 doses. Ça, c'est la priorité. Mais aussi, on continue avec la méthode d'offrir les dépistages pour les personnes qui ont des symptômes. Et c'est important, si quelqu'un a une mauvaise gorge ou une fièvre, c'est possible que c'est COVID-19. Et il faut aller faire un dépistage pour déterminer si c'est COVID ou non, parce que c'est possible alors d'identifier les points de transmission et de prévenir la transmission pour l'avenir. Et on continue avec ce système de dépistage et faire le suivi avec les personnes qui ont un dépistage positif et leur contact. C'est aussi une stratégie qui continue. Et aussi le travail de santé publique d'identifier les éclosions et travailler avec les lieux de travail et les différents employés de réduire les éclosions.
Parfait, merci beaucoup.
Avez-vous une suivi, Annie-Rose?
Non, ça va, merci beaucoup.
OK, merci. On passe maintenant la parole à Radio-Canada, Benjamin Vachet.
Oui, bonjour, merci beaucoup de prendre nos questions. Docteur Etches, j'aurais aimé vous entendre en français, si possible, sur la question justement de ces résidents qui se méfient du mélange des vaccins et qui vont peut-être annuler leur rendez-vous, ne pas se présenter parce que ce serait Moderna versus Pfizer. Est-ce que vous craignez justement qu'il y ait beaucoup d'annulations et est-ce que vous en avez déjà constaté?
En français, je voudrais expliquer que c'est vraiment important d'avoir les 2 doses contre la COVID-19 pour arrêter la transmission de la COVID-19, en particulier les variants de cancer. Alors maintenant, nous avons beaucoup d'informations que les différents vaccins Pfizer et Moderna sont similaires, sont la même science, la même efficacité, le même profil. Et c'est pourquoi je voudrais dire, n'hésite pas, parce que c'est maintenant on a besoin de la protection et il y a beaucoup de gens qui veulent avoir la 2e dose et nous n'avons pas confirmation quels sont les vaccins qui vont arriver les différents mois cet été. Alors, c'est important maintenant d'utiliser le vaccin qui offre bonne protection.
Une question de suivi peut-être par rapport aux variants Delta. Quelle est la situation à Ottawa? Dans l'Est ontarien, ils nous ont dit qu'ils avaient eu aucun cas, si ce n'est il y a quelques semaines. Est-ce que nous, à Ottawa, on est touché par ce variant-là qui est très contagieux?
Nous n'avons pas des personnes qui ont un dépistage positif maintenant. Auparavant, il y a des voyageurs, mais c'était quelque chose qui n'a pas augmenté. Mais il y a un délai avec le dépistage pour identifier le variant et c'est possible que c'est ici avec plus de connexion entre le sud d'Ontario et Ottawa, on peut imaginer que c'est juste une question de temps parce que c'est plus transmissible et c'était l'expérience avec le Delta, le Alpha, le variant Delta, quand cette variant était au sud, après il est arrivé ici à Ottawa et augmenté. Alors, on va continuer avec notre surveillance et tous les noms, les chiffres sont sur notre site web aussi.
Merci.
That is all the time we have for today. C'est tout le temps dont nous disposons aujourd'hui. Thank you and have a good evening. Merci.
Merci.